Dear Lord, we thank you for the gift of life today. You allow us to have another day to praise you and see your glory. Thank you for the love and protection, especially this time of pandemic. Bless us, Father, with your wisdom as we begin our class. Help us to focus our hearts and minds on what we are about to learn. Inspire us by your Holy Spirit as we think and listen. Guide us by your eternal light as we discover more about the world around us. Lord, we thank you and let your will be done in our lives. We ask all this in the mighty name of Jesus. Amen.
Di nagtatapos sa apat na sulok ng kwartong ito ang kwentong top rank. Mag-aaral, magsasaya, at higit sa lahat, magtatap sa board exam. Dahil sa top rank, pamilya kami.
So always remember, ang dami niyong opportunities, okay? What we offer in Asian is, you tell us what to do, and we will make it happen for you.
Don't ever let somebody tell you that you can't do something. Not even me. You gotta dream, you gotta protect it. You want something, go get it. Here.
Be confident. You have that knowledge. Later on, ang tanging hihilingin mo na lang ay enlightenment.
Parang may glass, offline, and I'll be right back at it by the end of the night.
Congratulations, top rank RNs.
Top rankers, congratulations. Kino-congratulate ko na kayo lahat kasi alam ko mapapasa nyo lahat yan dyan sa board exam na yan. And not only just pass it, but really with flying colors.
At sana lahat ng narinig nyo ay maalala nyo. At ngayon pa lang, kinocongratulate na namin kayo. congratulations dahil alam ko na kayo ay papasa at mapapabilang kayo sa mga top notchers this year. So congratulations in advance, Top Rank RNs.
Our first runners-up. The world is full of successful failures. Many of the most successful people overcome setbacks and disappointments to reach the top. Be the tenacious and the old-fashioned alchemist who turned metal into gold. Success is a state of mind. Always tell yourself, I can get through this. I will get through this. I must get through this. Saturday is your big day. Don't lose your chance. Live that day as if it were your last day. Your time is limited. Do not waste it living someone else's life. Know what you want in life. Define your own success and stop at nothing to achieve it. Don't ever let somebody tell you that you can do something. Not even me. You got a dream, you got to protect it. You want something, don't get it. Period. What is your goal, love?
Of different schools we start, with a single name in our part. The clash of battle is sweet to hear. Right now when the victory is near, excellence is our only standard to outshine the rest. With a great mind and compassionate heart, trained us to be the best we can be. All that we learned at Top Rank Review Academy. We shout with pride and heads up high as victors our dreams. soar to the sky. The train just to be the best we can be. Soar to the sky. We're there if you want the top rock, if you got it. Soar to the sky.
You are holding on to that dream. You have a choice today to go up or stay down. Now is the time to take the first step to the top. With quality review materials that produce board top-notchers and thousands of board passers across professions. In dynamic, innovative, and interactive review delivery. Ensuring an excellent, balanced, relevant, and comprehensive review experience. Extending support beyond review and celebrating victories together as one family. What you choose today determines your success, so make that powerful decision.
Welcome to the top.
Choose to be the top with Top Rank.
nag-help sa akin ng top rank talaga is that confidence. Nung pumasok ko, yun talaga yung nahanap ko sa top rank eh. Kasi I always question myself. And yun yung nagiging breaking point ko lagi. Imagine all those exams na every time na sobrang hirap, you try even harder. Tapos next exam, mas mahirap ulit. So you try harder again. So by the time na mag-PNLE na, parang, okay, give it to me, I can do it.
Very holistic po sila approach. Hindi lang po mentally, ano rin po sila sa physically, spiritually, and emotionally po. Tulad po sa stress management niyo po.
Sa top rank kasi, na-realize ko, there's so much more to learn. Every single day na nakaupo ko sa harap ng lecturers sa top rank, they've given me knowledge na nakuha nila from their experiences as nurse. Iba kasi yung top rank, parang pag naririnig ko siya, very, very welcoming. Tapos yung lecturers, very engaging sa students. And then, ayun, parang everybody really cared na kailangan makapasa tayo. Nagmo-motivate kami sa isa't isa. And then, ayun, basta pag top rank, iba talaga siya. As in, ibang level. So, never ako nag-regret na nag-top rank.
Naniniwala po ako na lahat ng student may potential. Top rank was there to harness me to the fullest extent of my abilities. From giving me top-notch lecturers, top-notch materials, environment, it never came short of providing me what is the best there is for me to improve myself and to help me achieve this goal.
Top rank po kasi mag-e-enjoy ka talaga. Ang naging review ko po sa top rank is fun, enjoyable, habang natututo ka ng maraming learnings. So, minsan gigising ako in the morning, parang tinatamad ako, bad trip ako, ganyan. Then, ma-realize ko, ay teka, funny yung prof ko Parang gusto ko ma-enjoy tong araw na to. So, ang gagawin ko, papasok po ako ng top rank. Then, uuwi ako, good vibes na ako. Ang dami ko pang natutunan.
Out of everyone na nag-take ng board exam, ako po yung top 1. Hindi pa rin po nagsisink in totally. Bali yung mom ko po yung pinaka-inspiration ko po. Kasi siya po yung reason kung bakit gusto ko po maging successful.
Sobrang proud ako na hindi ko ma-express yung feelings ko kung ano yun. Na hindi nga, that night hindi ako nakatulog. Pero ngayon, the same pa rin, para pa rin akong naka-float. Kala ko sa TV ko lang mapapanood. Na naranasan ko pala ngayon na kahit sa kabila ng mga experience mo ng mga hardships, meron din pala talagang hope na pwede kang mag-top of all.
Thank you po. Thank you. Hindi ko po din akalain na magta-top 1 ako, pero sa tulong po ng top rank, nakamit ko po.
To take it slow. Now I feel the air and take the long way home. This place is all I've ever known. No longer scared of the open road. 'Cause tonight is
a very fun journey. Minsan may ups and downs, pero overall nakaka-help yung top rank na ma-boost yung moral and yung drive mo to review and to be a top-notcher.
So, my experience with top rank was very fun. Unfortunately, minsan lang ako nakapasok on-site and the rest were online. Pero I really like yung mga recall exams nila and the way they gave the rationalization for the mga sagot sa mga exams na yun. And yun talaga, yung tumulong sa akin, the practice test po sa top rank. Because it honed po yung mga problem-solving skills ko and such.
Are you coming with me? Let's take on our fears from the start. 'Cause we'll have it hard. We'll have it hard.
400 to 500 questions per day. And yung mga papers nila, they gave us a glimpse of what the actual NLE would be. And that was really helpful, especially during the day of the exams.
Hi, this is Jana of La Raza, and I would like to congratulate all the top rankers for passing the board exam. We're very proud of you, and good luck to all.
We could be anything. Are you in? Are you out? Are you coming with me? Let's take on our fears from the start.
Yes, super sulit po sa top rank. As in, like, nung una ako nag-enroll doon, parang wala akong kaalam-alam. So, parang habang tumatagal, na-enhance yung the way ko mag-answer ng mga exams. Sobrang laking tulong nun. After ng board exam, na-realize ko na doon na-enhance yung way ko kung paano atakihin or kung paano ko sasagutan yung mga questions, especially yung mga questions na wala talaga akong idea dun sa answers.
Hello guys, this is Jason Fernandez at nasamantalayin ko ng pagkakataon. Congratulations sa top rankers natin. Nagbunga na ang inyong paghihirap. I'm sure proud lahat ng tao sa paligid nyo, especially parents nyo. Congratulations sa inyo at good luck sa susunod na yugto ng mga buhay nyo. So again, congratulations. Good job.
Sobrang sulit po sa top rank. Kasi yung mga, kahit sa kabila, sa lahat po ng mga sinabi nila, I think what matters the most is yung motivation po na binigay sa amin ng top rank, ng survey, and as well as ng mga lecturers ko na. So, sobrang sulit po sa top rank and hindi ko pagsisihan yung pag-enroll po dito. Sulit na sulit sa top rank!
Sulit na sulit sa top rank!
Sulit na sulit sa top rank!
Heavenly Father, we come to you today with humble hearts, seeking your guidance and wisdom as we begin this program. Lord, we ask that you would bless every person who has gathered here today, and that you would be present with us in a special way. We pray that this program would be a time of learning, growth, and fellowship for all of us. Help us to listen to one another with open hearts and open minds, and to support one another as we strive to serve you in all that we do. Please give us the strength and the courage to follow your will, and to use the gifts and talents you have given us to make a positive difference in the world. We pray all of this in your holy name. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Hayang magiliw, telas ng silanganan, alam ng puso, sa titig mo'y buhay. Upang hinirang, tuyagan ang magiting, sa manlulupin, di ka masisingil, sa
different schools we start, with a single name in our heart. The clash of battle is sweet to hear. Right now when victory is near, excellence is our only standard to outshine the rest. With a great mind and compassionate heart, our hope that trained us to be the best we can be. All that we learned at Top Rock Review Academy, we shout with pride and heads up high as victors our dreams shall soar to the sky. The trained us to be the best we can be. Soar to the sky. We learn that you are top of you can soar to the sky.
Good morning, RNs, and welcome to Top Talk, Coaching with the Nursing Icons. Kumusta kayong lahat mga RNs dyan? I hope you guys are all doing well because you know what, RNs, I am really excited as we will meet the three amazing women in the nursing industry who have given their time, effort, and knowledge to share it with us. So this week is not it's not like any other because I believe that all the information that we will be receiving today will definitely help us to be more confident in the upcoming board examination. So, who knows, maybe some of the topics na may encounter natin ngayon ay may encounter din natin sa parating na board exam. So, all you have to do is to sit back, relax, absorb, enjoy, and witness all of the methods provided by our nursing icons. So with that, please allow me to present to you our first guest speaker who is absolutely lovely and elegant wherever she goes. So allow me to share my screen. All right, so our first guest speaker obtained her Bachelor of Science in Nursing degree from the University of Santo Tomas College of Nursing, a center of excellence for nursing education. She had been a consistent university scholar. She had been a board top notcher in the Philippine Nurses Licensure Examination with a board rating of 89.6%. She graduated with Master of Arts in Nursing degree, magna cum laude from the University of Santo Tomas Faculty of Graduate Studies. She has been a faculty member of the University of Santo Tomas College of Nursing for 20 years. She has been teaching fundamentals of nursing, pharmacology in nursing, and medical surgical nursing. She has been an in-service educator and clinical instructor at the King Abdul Aziz University Hospital, Jeddah, Kingdom of Saudi Arabia. She holds an active RN license, State of California, USA. She is the president and program director of Magnet NCLEX Test Prep and Training Center in Orange, California, accredited by the Board of Nursing, California, USA. She has been a faculty member in West Coast University, College of Nursing, and as a clinical educator in Fountain Valley Hospital and Medical Center, Orange County, St. Joseph Burbank, Barlow Respiratory Center, Los Angeles, Presbyterian Medical Center, Van Nuys, for international nurses in California, USA. She is also the author of several nursing books, Fundamentals of Nursing, Concepts and Clinical Application, Medical Surgical Nursing, Concepts and Clinical Application, Comprehensive Review Book for International Nurses, Series 1 and 2, Health Assessment and Physical Examination, Theoretical Foundation in Nursing, Gerontological Nursing, Nursing Informatics. She is currently pursuing her doctorate in nursing in the US and doctorate in nursing management in Trinity University of Asia as part of her continuing professional advancement and to epitomize her advocacy that learning is a lifelong endeavor. Let us all welcome Miss Josie Q. Udan. Hello, Ma'am Udan. Good morning po.
Good morning. Thank you for that very kind introduction, sir. Nurses, it is always a pleasure to be part of your journey in your nursing career. So, you have been honing your best in gathering the concepts for the different courses in nursing or subjects in nursing. But what matters at this point is how would you apply these concepts in answering questions? Because usually the issue or hurdle is people know the concepts, but once it is in a situation or a question, some would not remember that that is the concept that is in issue. So, Udan paradigm, how to top the board, the PNLE, 80% knowledge base, or let's make that 70% knowledge base and 30% test taking strategies. You have to be smart in everything that you do. Don't make things so complicated and difficult. I just don't know your generation, the Gen Z, the millennials, you are very fond of complicated things. Sometimes I could see in a relationship complicated. Well, I'm a baby boomer. I don't understand what is a complicated relationship. But anyway, that holds true with the PNLE. You want questions that are difficult. But once the questions are basic and simple, you would say, "Nako naman, question ba yan sa board? Ang simple. Hindi ko tuloy masagot." Yan. So, you know, the only choice that you have at this point in your lives is to get that RN license. And your lives will be primed towards success. You better believe me, if I will live again, I will still choose to be a nurse because there's so many good things, so many happy things that are going on in our lives. Well, our lives will be full of challenges, but nevertheless, the rewards are unimaginable. Okay? So, for today, let me share my screen with you. Am I doing it right, guys?
Yes, ma'am.
Wait lang. I will present full screen. There you go. Tech-savvy naman si Ma'am Udan kasi 2009 pa lang sa US, hybrid learning na kami. Di ba? And besides, baby boomers may not be as tech-savvy as you are, but we could buy technology. Di ba? All right, guys. So, the first order of the day, critical thinking strategies for testmanship. Okay? Because taking a standardized nursing exam, just like the Philippine Nurses Licensure exam, is all about critical thinking. Well, that is a new term for what we called as common sense. Yan lang yun. Big word kunwari yung critical thinking. Pero that is common sense. Okay. Here we go. Observe, analyze, solve. And you're going to be a critical thinker. In Top Rank, we are committed to help you reach your goals and dreams. Because nursing is a global profession, so we will help you become global nurses. Being global does not always mean that you have to work outside the country. You could still be global by having the best practices that are being applied globally. Diba? Okay. Now, just to share with you a very touching quotation. It came from Václav Havel, the last president of Czechoslovakia. Vision is not enough. It must be combined with venture. It is not enough to stare up the steps. We must step up the stairs. It's not enough to dream. Come on, you have to move, do something. If you don't want your place now, so that you don't stay in that same place, then you have to do something. You can't climb the ladder if you just stare up the steps. So you have to walk the talk, okay? And always remember, guys, everything is possible. Your dreams, your ideas, your vision. Never let anyone tell you you can't. Be uniquely you. Stand out. Shine. Be colorful. You don't need to be having all those Latin honors like loudest. They are good actually. I enjoyed that. But when it comes to real world, para-paraan pa rin yan, anak. Strategy talaga yan. Okay? Now, the first is strategy. I said it simply. Read its question or situation carefully. It is easier said than done, I should say rather, because when you start the exam with a certain level of anxiety, you will not be able to read the question carefully. So once you start an examination, pray, even if it is just 2 or 3 sentences, take 3 deep breaths so that you will be able to do this. After which, reread the question and understand what is being asked. Ma'am Udan, doble? Yes, it's your future, anak. It's your future. Well, I've just been talking with somebody who came back from the United States. Well, I'm not being unpatriotic when I encourage people to broaden their horizons. Well, I was the one who encouraged him to go to the United States. And my God, sabi niya, Ma'am Udan, kaya palang kumita ng kalahating milyon sa isang buwan. Well, but you go somewhere once you are well equipped with knowledge, skills, and positive attitudes and values. Serve our country first. Come on, we need you here. So understand what is being asked. As simple as that. Ano ba ang tinatanong? And then answer the question. But you know, I based this assumption from my own observations of mentoring Philippine graduates for so many years. In fact, a total of 4 decades. And our Filipino mindset is this. We don't usually answer the question. Promise. Oh, ito na lang. Real life examples. Sabi, oy girl, ganda naman ng blouse mo. Ang sagot mo, ay, divisoria lang yan. You are not answering the statement. Girl, ang ganda naman ng blouse mo. The answer could have been, thank you, girl. Hindi niya tinanong saan mo binili yung blouse mo. And that happens in PNLE. You have to admit that, di ba? Or sabi, nasa work kayo. Ha? Girl, nag-break ka na. Hay nako, yung charge nurse na yan, ang dami kong ako pa yung discharge, ako pa yung ganito. Ang sagot, hindi pa girl, busy ako. Pero you already made the best speech. That you are not answering the question. So do I make sense, guys? I know you are agreeing with me. Now, as the framework of Udan books, I hope you did not photocopy my books. But I will never know, but God will know it. Bahala kayo dyan. Okay? And for those who supported my books, unknowingly, you have helped some children out there to have education. And these are some Aita children in Zambales, because I'm from Zambales. Hindi mo alam may natulungan kang bata. Kaya yung mga nag-photocopy dyan, you have just deprived some Aita children out there. Di ba? The framework of Udan books, concepts, and clinical application. So this time, even in the exam, I would help you out in applying the concepts. Read, reread, answer the question. Okay. I'll just read it wherever you are at. Maybe you are in Luzon, Visayas, or Mindanao. Okay. Now, in case of myocardial infarction, the nurse understands that aspirin will be effective for the client for which of the following primary desired effects. What is the issue? Aspirin. What is the question? Desired effect. There is a situation of MI. You have to be specific to the situation. Aspirin could be used even in arthritis. It could be used an analgesic, but you have to be specific to the situation. This is MI. And you know that one of the myriads of positive uses of aspirin is it will prevent blood clot formation. It is antiplatelet when it comes to MI. It will not relieve chest pain. It will not dissolve blood clots. Okay? What will relieve chest pain? That would be morphine sulfate. What would dissolve blood clots? That would be thrombolytics. Okay? Wait lang. How do I... it's blocking my... Okay. Now, next question. The patient has acute asthmatic attack. The nurse understands that epinephrine will be effective for the client for which of the following primary desired effects. Always remember, answer the question. What is the situation on hand? Acute asthmatic attack. What is the issue? Epinephrine. What is the question? Primary desired effect. Well, on perusal of the four choices, they are all actions of epinephrine. However, we have a situation of acute asthmatic attack. So you could key in your answers in the chat box. I will be reading them, okay? Because I want to have a feedback on how well you are doing. Para naman may kausap ako, ano? Okay. So, is it A, is it B, is it C, or is it D? Answer. I want it now in the chat box. You are 650 strong. Okay. Now, to guide you, what is the problem in acute asthmatic attack? Bronchoconstriction. Correct. So get the keyword from the choices. So it is a bronchoconstriction. dilator this time. Di ba? Because it could be antihistamine, it could be anticholinergic, it could be vasoconstrictor. But in asthma, the main problem is bronchoconstriction. So always attack the question with the primary effect, okay? Or consequence. Now let's have the next question. Wait lang. Congestive heart failure. There is shortness of breath. And the medication is Lasix, 40 milligrams IV push. What indicates effectiveness? The question is effectiveness. Increase urine output, that is the action of Lasix, okay? It's a diuretic. Now, decrease swelling. Well, does it say that the patient is having anasarca or swelling here? Now, how do I, wait a minute The bar of mute, stop video, secure, etc. is covering my questionnaire. I don't see the third one. And then the fourth is, there is decreased rales or crackles. What's your answer? Key in your answers, guys. Okay, I'll help you. There is shortness of breath. So something that is about breathing should be your answer. Boom. There is decreased rales or crackles. Yun yung, that's what I meant when I said answer the question. Ayan siya, oh, shortness of breath. In fact, the BON are very kind. They give you the clue. And then, multiple choice na nga lang andyan na siya, oh, nagmumurang katotohanan. That should be your mindset when answering question. You get the key from the question itself. O, diba? Pero hanggang 89.5 lang ang pwede nyong board rating. Pag nilampasan nyo ng 89.5, magagalit na si Mamudan. Joke lang. Sige, pwede kang 95 kung kaya. It's similar. It's similar question, but this time it's chronic renal failure having anasarca. It's still Lasix. What am I trying to point out to you? Never memorize answers to questions, because some people, some nurses have the tendency to do that, memorize. No, the answers to the PNLE would depend on the situation, available choices. Do you follow? Kasi kung minsan sabi, basta liver biopsy, right side. Basta liver biopsy, right side. They change the question during. O, di patay na. Di ba? Do not be, memorizing. So the issue is anasarca. So this is generalized swelling. It follows that your answer is letter B, Baguio. There is decreased swelling. Diba? Madali lang. Kaya lang, if nobody mentors you on how to make answering your PNLE in an easy manner, walay talaga. Okay? Now, next strategy that I want to share with you. If the situation is lengthy, read the last statement first because this is the question. O kunwari, lengthy yan. All right. So, what is the question? Huwag namang select all that applies the last. Silly, you're so funny. Which of the following signs and symptoms indicate dehydration? So, ang issue dito, dehydration. And then go to the situation. And look at, when it comes to dehydration, I would advise you to look at the age of the patient. Because if the patient is 65 years old and above, skin turgor is not an accurate assessment parameter. Because in general population, 65 and above usually have some degree of wrinkles. Oh, do not be telling me, oy, mommy ko 65, walang wrinkle. Remember, in the PNLE, they're talking about general population. They're not talking about your mom or your grandmom or your neighbor or your auntie. Diba? General population. So, dry mouth, yes. Okay? So, all of the choices have number 1. So, you could not delete that. That's another strategy. Ganun. Isa-isin mo, kutuhan mo. Highly colored urine, yes. So, alin dyan ang walang number 2? Itong letter C, crush na yan. Crush mo na. Poor skin turgor, yes, kasi below 65 siya. Okay? So, number 1, number 2, number 3. Weight loss, yes. Ano yung number 5? Bakit ba hindi ko maibaba itong icon na to? How do I do that, sir? Ayun. Ay nako, Mrs. Udan. Okay, oliguria, yes. So, letter B has no number 3. Out na yan. Kanina na-out na natin yung letter C. Ang letter D, walang number 5. Out na yan. So, boom, the best answer is all of the above. You know what? The present set of BONs are very fond of asking SATA questions. Select all that apply questions because they want to evaluate you if you have thorough knowledge on a particular topic. Ganun lang yun. Okay. Now, this time, Mr. J. Okay, wait a minute. I was telling you, pag mahaba, although hindi ko mahabaan kasi mawawala sa within the PowerPoint. Ayan na lang. Nurse Rian should include which of the following information to be given to the client. So it's giving information. Then back to the situation. All right, the patient is Mr. Male. Okay? I want you to take note of the age, the sex, the marital status, and so on. Because sometimes this socio-demographic profile will have a bearing on your answers. So this is a male patient and it's about early cancer detection. Perform TSE. Yes. So anything without number 1, crush mo na yan. Letter B, crush. Letter C, crush. Oh, you have streamlined your choices. Dalawa na lang. Is that not making life a lot easier, anak? Ganun. Kasi kung ganitong gawin mo, letter A, 1, 2, 4. Ay, letter B, 2, 3. Ay, paulit-ulit. You will be wasting a lot of time. You might not have adequate time, to transfer your answers. Annual digital rectal exam. Yes, we do that among males. Monthly breast self-exam. There you go. If you did not take note that the patient is male, basta early cancer detection lang, baka chinek mo yung do monthly BSE. Do I make sense? Ha? Mister. So, hindi mo gagawin yan. So, anything with number 3, out na yan. So, yung letter B, may number 3, out na yan. Yung letter C, may number 3, out na yan. Yung all of the above, may number 3, out na yan. Diba? You don't even need a minute. Okay? And then have baseline procto, yes. Annual mammography, ang kulit ba? Mama ngayong patient diba? Out na yan. Annual pap test and pelvic exam. So, Ginoo, nagpe-pelvic exam ba si mama? Hindi. So, boom. The best answer is letter A. Aguo. 1, 2, and 4. Are you happy, guys? I hope you are. All right. Another strategy that I would like to share with you. Pay particular attention to words such as best, most, first, initial, highest, priority, inappropriate, least, except, and not. Remember that least is equivalent to not because they matter in the exam. Your answers will depend on the presence of these terms. So, focus. Kailan focused ka? Huwag lumilipad ang isip while you are having your exam. Focus lang. Just remember, this is my future. I'll be a nurse for all my life. Ganon. Huh? You will not regret if you follow this career path of being a nurse. Maraming masasayang ganap. Of course, I would not be able to tell you everything, pero ako talaga, naging masaya ako sa buhay. Well, aside from having a good family, also having a good career. You know, yung good career na yan, success, is a mindset. Isipin mo, na-achieve mo yung goal mo na to, you are successful. Diba? Okay. Now, so this is about emergency and disaster response. Look at the situation. The child has pain, swollen lips, and shortness of breath. When you have this situation, bitten by a sting or centipede or bee, what you have in mind is anaphylaxis or anaphylactic shock. That is because of shortness of breath. If there is no shortness of breath, that's not anaphylactic shock yet. O anaphylactic shock, ano ang priority action mo? The letter A, epinephrine, the EpiPen. Transporting may take time and the patient may die already because of complete closure of airway. Acetaminophen, it doesn't work this time. Again, ice and ice, when two choices are similar, parehong may ice na ganyan, or basta may similarity, they're usually distractors. So, wag kang pa-beta blocker. Ma'am, ano po ba yung pa-beta blocker? What is the suffix of beta blockers? Olol, diba? Metoprolol, pindolol, atenolol. So instead na sasabihin mo, kailangan magiging RN ka na. Pati terminologies mo, refined. Elegant na ang iyong manner of speech. Instead na sabihin mo, hey, hindi mo ako maulol. Hindi mo ako mabibeta blocker. Okay, hindi mo ako mamitoprolol. O diba? Ang sosino, saya. Okay, now, this time, it's about full-term newborn undergone vaginal delivery. Ma'am Udan, why are you using different courses or subjects in your examples? Because I want to point out to you guys that these strategies could be applied not only in med-surg or fundamentals of nursing, but also in other situations. You could apply it in peds, you could apply it in maternity, you could apply it in psych, you could apply it in palmar, whatever, okay? These are international strategies. And I tell you what, I have used these strategies in different countries. And the wonders of effects are really very amazing. So I've been using this with different nationalities in the United States. And then it came to my realization, bakit ba puro taga-ibang bansa ang tinutulungan ko? Anong nangyari sa aking responsibility sa sarili kong mga compatriots? That's why in 2009, I started coming back to the Philippines. And, you know, I started up muna sa Mindanao at saka sa Visayas. And yung ang passing rate noon, 20%, 30%, na may warning na ng CHED na if you don't have above 50% passing rate, isasara ang school. So, Ginoo, that is very lamenting. So, I started there. And my God, amazing talaga. So far, walang naisarang school among those. Diba? Okay. Now, sabi nga nung iba, si Ma'am Udan, sa iba, binabasa lang libro, sa top rank, nakikita at naririnig namin siya. Diba? Buhay pa siya. Kasi minsan sa Jensen, may nakasakay ako sa elevator na very innocent looking young girl, pero ano pala siya, Review within. Kala ko little girl BSN graduate din. Sabi niya, ay Mamudan, ikaw yung libro. Aray ko, hindi ako libro anak, tao ako. And then sabi niya, alam mo ma'am, akala namin, patay ka na, buhay ka pa pala. Ha? Fake news yung patay ako, ang healthy-healthy ko kaya, namamayagpag ako sa Amerika at pabalik-balik sa Philippines to do my apostolic work for my own people. Imaginin mo, pinatay ako. O, sige na. Normal newborn, most likely be observed. Normal. Head circumference, 31 to 33 cm yan. That's why, sabi ko, 70% knowledge base. Hindi pwedeng puro strategies. Pero knowledge base without the 30% strategies may not really be having a good probability of passing the exam or getting the right answer. O, cone-shaped head, pwede. Rewarding of molding. Remember, vaginal delivery yan. Huh? Remember, in the PNLE, rewording is the name of the game. They will not always place there the obvious term. Kailangan you know how to interpret. Okay? Anterior fontanelle is bulging. Well, when the anterior fontanelle is bulging, we suspect increased ICP. That's not a good one. Positive scarf sign. Well, that is a sign of prematurity. And the issue is normal newborn. So boom, the answer is letter B, Baguio again. Okay, paano ba na nga yung scarf sign? Well, in a newborn, try to place the arm across the chest. If there's no resistance by the shoulders, it means that positive scarf sign implies that the newborn is premature. Dapat may konting resistance dito. Pero pag wala, tuloy-tuloy yan across the chest, then that would be prematurity. Di ba? You use the process of elimination using your knowledge. Future mo yan, anak. Masarap ba may RN license? Yes. Very happy. Di ba? Another strategy that I could share with you. Try to turn options into true or false responses if possible in order to narrow down to 2 possible options. Paano yan, Ma'am Udan? First, classify stem of the question as positive or negative. If the stem is positive, the correct answer is true statement. But if the stem is negative, then the answer will be a false statement. Ano yung positive stem? Ano yung negative stem? Here goes. Ito yon. Positive stems should include the following: appropriate, understands teaching, to be included, indicates effectiveness. So anong sagot? Look for a true statement. Yes. Sige, application uli. Framework ni Mamudan yan eh. Concepts and application. What is the issue? Cranial nerves 1. Ano na nga ang cranial nerves 1? Olfactory. Do you remember yung to touch and feel a girl's vagina? So heavenly. Ang obscene ng alam yung mnemonic. But well, that's your generation. Kasi nung kami, masabi-sabi mo lang yung to touch and feel a girl's vagina, edi may sampal ka sa din ninyo. Din namin, no? Anyway, kami kasi noon, history, storytelling, so that you will remember. On Old Obando Tower, top a Filipino army guarding villages, stores, and houses. Di ba? Boring yan sa inyo. Pero sa amin, well, yun yung socially acceptable. Well, I accept that times change. Diba? Olfactory. So, pang-amoy. Diba? It's for sense of smell. Hanapin mo kung saan may smell dyan. Correct ka dyan. I agree with you. It's letter C, California. Have the client smell coffee. Anong cranial nerve yung shrug shoulders? 11. Okay? Ano yung turn the eyes from right to left? That is abducens, the one that you use during examination. Turning your eyes to the right and to the left. Joke lang. Smile and frown, that is facial nerves. So you see, with one question alone, the Board of Nursing had evaluated you on your thorough knowledge in the 12 cranial nerves. Kaya pag sinabi mo, 500 questions, na may measure talaga yung capability ko to become an RN level 1? Yes. Kasi one question, ang dami na nilang na-evaluate na. O, di ba? Kaya when you pass the exam, ang galing-galing mo talaga, you will feel that your self-esteem will greatly be enhanced. But remain humble. Humility palagi will bring you to success. The more that you will soar high if you remain humble. Okay. PTU, propylthiouracil. Anong grade this is? Hyperthyroidism. Effectiveness. So it means that the signs and symptoms will be relieved. Don't worry, tomorrow I will help you memorize long list of signs and symptoms of different diseases just in 2 to 3 minutes using Udan concepts. I'm not bragging. Well, the Udan concepts that I have designed are generalizable. In fact, I have submitted that in one of my subjects in a doctorate level, and it was approved kasi validation and reliability tests were done. Diba? Ngayon, the appetite is increased. Hindi nga may increase appetite sila. Diba? The weight is increased. Pwede. Because they usually have weight loss. O keep that knack. The body temperature increase. Hindi. They usually have elevated vital signs. The pulse rate is increased. Hindi. It's similar letter C and letter D. The vital signs are increased. These are manifestations of Graves' disease. Everything is high and fast. Okay? So the best answer is letter B, Bronx. Okay? Because they have weight loss due to hypermetabolism. Di ba, anak? Now, you are appreciating the lectures that you had in a few months' time. And your instructors had been, painstakingly sharing with you those concepts. Now, apply na apply mo. Saya, di ba? All right. Oh, this is the one that may have happened to some of you. Which step have you reached today? Nung una sabi, merong review with the icons. Well, kuminsan tinatawag kaming Ilocano triumvirate. Bakit Ilocano triumvirate? Kasi si Ma'am Lucy Espinosa, si Ma'am Teres Pacabis, at si Ma'am Udan na taon, puro mga Ilocano. Kaya lang ako kasi hybrid. Hybrid ako kasi kalahating Kapampangan, kalahating Ilocano. Diba? Sabi mo, hay, babayad na naman. I won't do it. Busy ako. I can't do it. And then, your classmates had been giving feedback to you. Sige, attendan na natin lahat. May matututunan. Sabi mo, okay, I want to do it. But how do I do it? Ang dami ko pang backlog sa babasahin. I'll try to do it. Na-motivate ka. Sinabi ni Ma'am Udan, possible pala someday, kalahating milyon, kaya kong kitain sa isang buwan? Oo, kasi anak, kunwari, masipag ka. Sa US kasi, ang full-time job ay 3 days lang. May 4 days ka pa na bakante. O, syempre, sa una, pasyal-pasyal. Gusto mo makita yung 50 states. Asa ka dyan. Ako, ang tagal ko sa Amerika, pero hindi ko napuntahan lahat ng states na 50. Kapagod naman. Pinili ko lang yung mga may historical values, ganon. Okay. Tapos, sabi mo, this morning, Sige na nga, I will do it. Oh, and then you are with Ma'am Udan. Yes, I did it. And I tell you, I will make it a point that your 3 sessions with me will be worth it. Sabi ng top rank, sulit. Sulit na sulit. Diba? Oh, and whenever I face my own people, kahit online, pinag-preparean ko kayo. Ha? Oh, hindi pwedeng naka-duster lang si Ma'am Udan. Okay. Sige na, anak. Wow, you are already 693. Sige pa. Now, what are the negative terms? Ito yon: inappropriately, is not exempt, needs further teaching, needs intervention, needs follow-up. So, ano ngayon ang magiging answer? False statement. Kaya ano mo, true, false, true, true, o di yung false, negative eh. Okay, should not be included. It's about use of meter dose inhaler with steroid. Not, ito, rinse your mouth with water after taking medication. True or false? True. Why is that so? To prevent fungal infection or oral thrush. Okay. So, ano yan? True. Kaya out. What are we looking for? False statement. Shake the inhaler. Ay, true yan. Out siya. Hold your breath for 10 seconds. Pwede. Alam nyo, anak, whenever it's holding breath sa nursing, whatever the procedure is, kunwari, for liver biopsy, before the insertion on needle, how many minutes you tell your patient to hold breath? Palagi yan, 5 to 10 seconds. Ha? Magbilang ng 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hinga. Ganon. Huwag kang magpapahold ng breath ng more than 10 seconds. Kasi kung hindi naman yan swimmer, hindi yan makakahold ng breath longer than 5 to 10 seconds. Inhale, press, exhale. Kalokohan yan. Inhale ka, press, exhale. Who gets the medication? The nurse. Ay, the nurse. Ibinuga niya yung steroid. Kaya dapat, the mnemonic is E-P-I. So that you can easily remember it. E-P-I. Exhale, press, inhale. Does that make sense, guys? O, di ba? Nakaka-happy? Kung itinuloy mo lang matulog kasi linggo, na-catch mo ang mga ganito, magagamit po yan during your exam, anak. I tell you. And you might be having auditory hallucination of hearing my voice. That is a very pleasant hallucination. Sabi ko sa'yo, negative. The answer is false. Yan. Maririnig mo ako, promise. Alright. Now, inappropriate, may leukemia, immune compromise. And the issue, diet. What is the concept here? Ano ang bawal sa mga immune compromised people na food? Raw. Diba? No raw foods. No refrigerated foods. Kailangan freshly cooked. Basta immune compromised. Kasi yung refrigerated foods, meron na yan growth ng bacteria. If you're not immune compromised, yung bacterial growth na yan will not cause you infection. Pero pag immune compromised ka, naku, nakaka-diarrhea yan. So, ang letter A, cooked. Ano yan? True yan, kaya out siya. Fresh fruits, uncooked. Naku, pwedeng inappropriate, but don't be a trigger happy. I-retain mo lang, basahin mo yung ibang choices. Freshly cooked chicken tinola. Freshly cooked, hindi niya sinabing raw chicken. Ano ba? Ano ba? Okay, spaghetti with meatballs cooked. So, I go for letter B. Rewording talaga. Sabi nila sa lecture, no raw foods. Wala namang raw. Ay, oo nga no, fresh fruits, edi raw. Diba? Now you know, anak. Happy ka? Ngayon, Bill Ruth 1. Prevention of dumping syndrome, not a component. Ano yung false? Diba in dumping syndrome, we want to prevent rapid emptying of the stomach. Okay? To prevent shock-like manifestations. Kaya dapat nakahiga-higa, di ba? O, letter A, that's a true statement. Not. Kaya false statement ang answer. Letter B, that is a true statement. Letter C, nako, bilis ng pag-empty ng stomach yan. So, maaring yan. False yan. And letter D, avoid concentrated sweets. That is a true statement because lalong manghihila ng plasma from the intestinal capillaries. Kaya, not a component. False statement is letter C. See? It's getting easier now, no? Now, ito, needs intervention. It's about CD. Avoid touching, that is a true statement. Out. Remove the gloves, that is a true statement. Why remove the gloves first? Well, they're the most contaminated PPE. Yes, yan. Letter C, proper discarding of needles, that is a true statement. Out. Remove sa mask. May gloves ka, merong urine yan, may blood, may fecal waste. Hawak mo yung mask mo, di napunta sa face at hair mo yung contaminated excretions and secretions. Kaya the false statement is letter D, it becomes the best answer. Did you get that, guys? Okay. Mahirap pala walang kausap. Nasaan na yung chat ko? Ay, meron. Good morning pa rin. New messages. I would just like to read. Okay. Ano yung number 13? Kanina pa nalampasan yun. Number 13 na yun. Okay. Balikan natin later on, anak, ha? Alright. Accidental poisoning needs further teaching. Negative. Alin dyan ang false statement? Letter A, that's a true statement. Letter B, that's a false statement. Remember, when the ingested substance is corrosive, never induce vomiting, else there may be damage to the esophagus. And then letter C, that's a true statement. Out siya. Letter D, that's a true statement. Out siya. When it is negative stem, the correct answer is a false statement. It's letter B. Okay. Galing na, naman ninyo, no? Which of the following assessment data, how old is the child? 18-month-old. Needs follow-up. Needs follow-up, negative. Something is wrong. Anterior fontanelle is closed. That is normal. Positive Babinski. When should positive Babinski disappear? Around 12 months, di ba? Has 12 teeth. Pwede. Kasi what is the formula for computing the number of teeth? Na hanggang 26 months lang, ha? Huwag naman lampas-lampasan ng 26 months kasi ang milk teeth ay 20 lang. Di ba? So, up to 26 months, applicable ito. Age in months minus 6 equals number of teeth. Age in month minus 6 equals number of teeth. O 18 month minus 12. Minus 6, sorry. 18 months minus 6 equals 12 teeth. Kaya pag ang baby, 12 months old minus 6, how many teeth? Correct, 6 teeth. So remember that shortcut formula. Ano yan? Ang nagbigay niyan si Donna Wong. Well, may she rest in peace. Siya yung author ng napakagandang pediatric nursing book used internationally. Yun. Okay? So, age in month minus 6 equals number of teeth. Yun. Ngayon, throws ball overhand. Yes, pataas na kung mag-itcha ng bola yung 18 months. Pag yung pag-throw niya ng ball pababa sa floor, 15 months lang yon. Pero pag pataas na, mag-uumpisa na yan sa 16 months. Yes, assessment. Now, if two options say the same thing, you have to learn. You have to develop the skill na, ito ba magkaparehong sinabi nila? Ayan. Neither can be the answer because both are distractors. Application. Wait. Application. may fever, may diarrhea, yung may cancer of the ovaries. Tanong niya, do you think that I'm going to have surgery? O may pagka-theracom ito. The best response by the nurse in the situation would be, tingnan nyo to ha. Letter A, physician. Letter C, physician. And letters B, physician. May tatlong physician. Or the bottom line is, sa theracom, focus on feelings. Ang dami mong pwedeng gamitin na concepts so that you could get the correct answer. So how could you be wrong? Diba? All right. Are you afraid to have surgery? Kasi yan yung focusing on feelings. So the other way is whenever there are options which are similar, they are not the answers. So dalawa kaagad na strategies na gamit mo dyan. Kaya sure na sure ka, tama ang sagot nyo. Okay? Are you afraid to have surgery? Yun. Focus on feelings. Because the patient would feel that you have entered his or her inner thoughts, inner feelings. So you will be able to establish rapport. Yun. Okay. O don't pass the buck. Think what is a nursing action that RN can do before calling the MD. Meron ka bang dapat gawin as an RN bago ka mag-refer? Yun lang ang ibig sabihin niya, anak. Ha? Consider all other options before making any referral. O application. Sorry. Do you think I have anything serious like cancer? O sabi ni Mamudan, ang isa ay focus on feelings. And of course, you have to be honest. Sabi mo, if I were you. Diba, sabi ni Ma'am Lucy, advising is non-therapeutic. Kaya yung ka-advise mo sa friend mo, hindi yan effective. Hindi ka susundin. Lalo na kung tungkol sa love. Nako, friend, yung boyfriend mo, ganito, ganyan, ganyan. Nako, wala advice. Kung ako sa'yo, i-break ko yan. Nako, hindi ka susundin. Kasi, ang love, nakakabaliw, nakakabulag. Marami nakaka-relate dyan. Kaya wala na yung if I were you, nagsasayang ka lang ng energy mo. Okay? Why don't you discuss this with your doctor? Yan, passing the buck. Ikaw ang tinatanong, ba't mo siya nire-refer ngayon? Nakausapin na lang niya yung doktor. Para mong sinabi, ay busy ako, yung doktor mo ang kausapin mo. Yan ang implication niyan. Always have time to talk to your patients. Alam nyo, yan yung napatunayan ko. Whether dito sa Philippines or sa ibang bansa, give them just 5 minutes of your time for psychosocial care. They will love you. They will love you as their best nurse ever. Totoo yan. Lalo na si Mamudan, machika. Ay ang mga matatandang, mga senior na white Americans, gusto nila may kausap sila. Oo. Yung psychosocial na yun, di pumatak na yung metro mo, ilang dollars na yun, di ba na? Okay, now, I don't know if you do, but let's talk about it. Alam nyo, alam ko, nag-aalangan kayo sa I don't know. Kasi tayo, parang takot tayo magsabi ng I don't know. Pero dinagdagan niya ng let's talk about it. That made it correct. Mag-usap tayo. Alam nyo, ang pag-uusap, very therapeutic yan. Kaya maraming countries at war kasi hindi sila nag-uusap. Do you get me? Ano yung chat? Hindi ko makita eh. May question ba? Sino bang admin? Kung may tanong ha, ipunin ninyo, and then at the end, I will answer. Yes? Okay. Thank you. Sino ang admin ngayon? Hello, sino admin ko? Jenaline?
Sir, po.
Ay, Sir Ron. Okay.
Sir Al po. Hi, ma'am.
Hi, Sir Al. Aro, Diyos ko, na-miss kita. Nangapampangan na eh. Okay. Ngayon, let's talk about it. Talking is therapeutic. Kaya nga maraming nag-aaway dyan eh. Hindi nagpapansinan, hindi nag-uusap. Ang pinag-awayan nyo, yun pa noong group work ninyo sa leadership management or group work ninyo sa research. Nakagraduate kayo't lahat, di rin kayo nag-uusap. Magiging RN kayo, di nag-uusap. Aba, malay mo, 10 years from now, magkita kayo bigla sa isang lugar. Biglang na-miss ninyo ang isa't isa, tapos it will come to your realization, ay, kaaway ko pala to. Di biglang nawala yung hug. Huwag kayo mag-ipon ng enemies. Mag-ipon kayo ng friends. Okay? Now, don't worry. Yung don't worry na yan, sa nursing, hindi yan magiging tamang sagot unless sinabi ng therapeutic. Do you get me? Kaya the best answer is letter C. Letter C. Because there are many tests that will be done to prove the diagnosis of cancer. Marami yan. Okay. Blood transfusion. Hemolytic reaction. Nurse's first intervention. Hindi call the physician because that is passing the buck. Do something first that an RN can do. Stop. Huwag mo lang slow. Nag-hemolytic reaction na nga eh. Stop. Yung document, last step mo yan. Do you get me? So letter D. Dagupan. Dallas. Whatever. Okay. Committed an error. What will you do first? Passing the buck is notify the physician. Do something first. You have to assess the patient so that you have gathered the necessary information before calling the doctor. Don't waste the time of the doctor. Busy yan. Gusto mong, you want to be screamed at. Kasi sabi, you called a doctor. Doctor, the patient is having this problem, ganyan-ganyan, because, I committed giving an error in giving medication. What is the vital signs? Ano ang observations mo? May skin rashes ba? Wait lang, doctor, ha? Kunin ko yung vital signs. And then you put the doctor on hold. Ano ka ba? Don't do that. So, it's letter A. Assess first. Do you follow, guys? Yung incident report, yung documentation, last step mo yan. Antidote, wala naman sa situation yung antidote. So, do not add to the question. Bawal ang dagdag-bawas. Pag wala sa question, huwag mong dagdagan. Hindi ka board of nursing. Examine ka. Okay. Remember the nursing hierarchy. Practice chain of command. Ethics yan. Go to the next line of nursing, authority. Do not bypass. Okay? Sige. Physical abuse of the child. Anong gagawin? Si nurse supervisor ba? Immediate supervisor mo yan? Next line of nursing hierarchy? Pwede. Si chief nurse, ang dami mo nang nilampasan. Okay, nilampasan mo na lahat ng yung nurse supervisor mo, yung immediate na nurse supervisor mo sa unit, maring yun yung charge nurse mo. Hindi naman kinakailangan nurse house supervisor. Okay. Attending physician, bakit hindi ito ang sagot? Because he is not your immediate supervisor. Nurse ang iyong immediate supervisor. Bakit ikaw ang mag-report sa police? That is the duty of your supervisor. Huwag kang adilantada. Pero promote mo ng sarili mo ng supervisor. Nasa ano ka pa lang, orientation period. Do you get me? So yung next line of nursing hierarchy is supervisor. Letter A. Ito naman. Appropriate action. Smelling alcohol. Si RN. Sa PRC agad, grabe na to. Supreme Court ka agad, out ka. Nursing supervisor, pwede. Next hierarchy. O NSO, nag-bypass ka na naman. Human resource, another bypass. Alam nyo, may mga similar questions sa board na ganyan because I want to know if you know how will be your decision making or actions if you confront certain situations in the clinicals. Yan. Okay? PRC agad, grabe. Now, do not add to the questions. I was telling you that, alam nyo tayo mga Filipino, mahilig tayo magdagdag bawas. Kasi naman, pag case presentation, buhay pa yung pasyente, ipapa-explain sa atin lahat ng ganap, complications, hanggang death, buhay pa yung pasyente. Kaya nasanay kayo sa ganyang mindset. Pati sa exam, nilalagyan nyo. Huwag kang mag-istorya kung wala doon. Hindi ka BON. Tandaan mo yan. Kung period siya, period siya. Yes, ma'am? O ito, WBC 3,000. What does that mean to you? Mababa, di ba? Ano bang normal? 5,000 to 10,000. So immune compromised. So ang health teachings to prevent infection. Number 1, yes. Lahat naman ito may number 1. Teka, yung letter D walang number 1, crush na yan. Do you remember what I told you? Okay, number 2, yes. Lahat naman itong natira may number 2. Number 3, yes. Kasi what do you get from crowded places? Infection like respiratory. May 3, may 3, may 3. Number 4, sabi ko na sa inyo yan, may harbor bacteria. Lahat naman yung natira, may 4. Number 5, soft bristled toothbrush. Is this for prevention of infection? No way. It is to prevent bleeding. You know what? Diyan nahuhuli yung iba. Maganda kasi yung statement, pero hindi niya sinasagot yung tanong. It does not answer the question. Immune compromised ang situation, hindi bleeding. Kaya yung may number 5, wala na. So letter A, no more. Letter B, no more. Kaya tingnan natin, avoid exposure to cold and dampness. Yes, because that will that will lower infection, yung cold and dampness. Kaya the correct answer is letter C. Pero alam mo, kung hindi mo alam yung techniques, parang lahat ito tama, di ba? Pero yung pala yung number 5 does not answer the question. Happy ka anak? Di ba? Realization yan. Alright, next. AIDS. Meron siyang pneumocystis jirovecii. Alam nyo yan? That was the pneumocystis carinii pneumonia. Yan yung new name niya, pneumocystis jirovecii. Alam mo na yan, pneumonia yan. So ano ang precaution? Di droplet, di ba? Pneumonia yan eh. So parang katunog kasi. Kapakapain mo na pneumocystis, pneumonia ito. Di droplet. Huwag kang nagugulat sa mga ganyan. You think of a similar situation. Try to predict the correct answer before making the choice. Alam nyo, if you study to the mastery level, this is the strategy that you will be using most of the time. Predict. And if the actual word does not appear, the next thing to do is think. Ano kaya ang rewarding nito? Kunwari, sabi, the medication is hepatotoxic. Wala ka naman nakitang hepatotoxic. Pero meron siyang yellowish sclerae. Yun na, liver eh. O kaya, yung AST niya, ALT elevated, liver pa rin yun. Those are rewardings. Diba? Makes sense. So, predict. You have to study to the mastery level. Okay. Diabetes, predict. The glycosylated hemoglobin, there you go. It's in letter A. Good job, guys. I'm so happy with your performance. Warfarin. Oh, what do you monitor when a patient is on warfarin or Coumadin? Prothrombin time. Do you see it in the choices? Yes, boom. You are letter A. Itong activated partial thromboplastin time or APTT, it is for monitoring the effect of heparin. Pag PT, Coumadin. Pag APTT, heparin. Okay, take note on that. Now, using crutches. Oh, so it's about using crutches. What teaching? Positive. Letter A, no way. That will cause crutch palsy. Huh? Letter B, flex. Yes, that would ensure that the weight is borne by the palms of the hands. That is the orthopedic position of the elbow when using, what do you call this? When using assistive devices, 30 degree. Put the crutches 6 inches forward and 2 inches to the side. Parang baliktad. And then, to have the crutches measured 4 to 5 finger widths below the axilla. Dapat 2 to 3 lang. Kaya ang tamang sagot ay letter B. Elbows flex at 30 degree at the crossbar of the crutches, Bronx. Kaya ito, baliktad yan. Dapat 2 inches forward and 6 inches to the side. Ito letter D, 2 to 3 inches. Finger breadths. Okay. O, ito na. Hyperopia. What is hyperopia? Farsightedness. How do I know that the Snellen's result depicts hyperopia? When the denominator is lower than 20. When the denominator is lower than 20, that is hyperopia or farsightedness. When it is higher than 20, that is myopia or nearsightedness. Itong 20/20 vision normal. Itong letter B, that is myopia. Itong letter C, that is the hyperopia. Letter D is legal blindness. So I repeat, the best answer is letter C. Okay. Now let's have the next question. We're progressing well. Greenhouse gas. Ay, Ma'am Udan. Yan ba tinatanong? Abay, oo. What is the main problem of the planet Earth nowadays? Climate change. Kaya, di ba meron kayong subject na emergency and disaster nursing? O, yan. Kaya, it is carbon dioxide. Yun. Do you know that the more that we eat meat, the more carbon dioxide is released in the environment. Kaya, ayan, eat veggies. O, maraming nag-ano dyan, maraming nag-promote, ayoko ng veggies. Bala ka. Basta, contributor ka sa greenhouse gas. Okay. Now, let's have the next question. O, ano ba to? Earthquake. Edi drop, cover, and hold. Pag fire is burns, stop, drop, and roll. Pag burns. Pero pag earthquake, drop, cover, and hold. Yun. Oh, di ba? You have to be well versed with disaster nursing kasi all over the world, the Philippines is number 3 in the most frequently stricken countries with disasters because of our situation in the west rim, okay, of the ring of fire, the Pacific Ring of Fire. Sige pa. Breathing pattern, having diabetic ketoacidosis predict. Edi, Kussmaul's breathing. Hindi yan Kussmaul. That's Kussmaul's breathing. Deep, rapid breathing in an attempt to reduce acidemia by lowering carbon dioxide level. But sa diabetic ketoacidosis, think about Kussmaul's. That is rapid and deep, that is deep, rapid breathing. Deep, rapid breathing. Okay, next. So, ito yung normal breathing, ito yung Kussmaul's, deep, rapid. Ito yung Cheyne-Stokes. Yan yung breathing ng pwedeng dying person and other disease conditions. Next, another strategy. Be familiar with normal laboratory values. Kaya pag tinanong mo ako, Ma'am, kailan bang i-memorize yan? Gusto mong kumita someday ng kalating milyon sa isang buwan? Sige. Imagine yung sweldo mo ng isang araw, magiging sweldo mo ng isang buwan. Pero, you know what? It's a matter of choice. Di ba? May kaibigan ako, ayaw niya talaga mag-work sa abroad. So, kasi sabi niya, the wealth is there sa Amerika where I am at, okay? The wealth is there, but the joy is here. Tama siya. Oo. Kaya madalas nandito na ako. Okay? Kasi pa-retire na rin. Alright. Pero I don't think, I can't see myself retiring. I will not be having a regular job. Ang traffic dito, ayoko na. Tapos, pag nag-skyway ako from Las Piñas, mahal. Puro ako skyway. So, mahal din. Kaya sabi ko, gusto ko yung yung ganito, final coaching, konting teaching load sa ganito, sa ganyan, ganun lang. Pero yung regular job na nandyan ako sa traffic araw-araw, parang stressful. At saka hindi ko kaya mag-drive dito sa Pilipinas. Diyos ko. Sa Amerika kasi, madaling mag-drive. Someday, malalaman nyo yung sinasabi ko, bakit madaling mag-drive doon. Tsaka dito, minsan ako yung nasa lane eh. Maya-maya ako na yung wala sa lane. Ba't ganun? No? Sige, normal laboratory values muna tayo, nak ha? Para bright future kayo. Gusto ko bright future kayo. Kasi sa aming mga parents, what will make us proud? Yung achievements na maanak namin. Yung achievements namin, wala yan. Dekorasyon lang yan sa buhay. Pero pag ang anak naging successful, naging mabuting tao, naku, trophy ng pagiging best mom and best dad ever. Pasayin natin yung parents nyo. Ha? When the question includes love values, is it too high, too low, or normal? Kung di mo minemorize, syempre chosen lang naman yung memorize nyo. Okay? Nandun sa libro ko, bahala kayo dyan. Okay. Yan. What does serum potassium of 5.8 mean? Mataas. Mataas yan. Kasi 3.5 to 5.5. Yung ibang libro, 3.5 to 5. Pero kunin natin yung 3.5 to 5.5. Although pag nag 5.5, medyo, bantay ka na, medyo nasa high normal. Alam nyo naman ang effect ng potassium, primarily sa heart, delikado. Alin dito ang pwede? Kasi siya ang pinakamababa ang potassium content. Di apple, yes, ang apple, mababa sa potassium content. Kaya yung may renal failure, pwedeng kumain ng apple pie ni Jollibee. Ay, may apple pie nga ba sa Jollibee? Saan nga ba yung apple pie? Yung, ganyan, no? Basta. Nagutom ako, Sir Al. Okay, watermelon, papaya, pineapple, hindi pwede. They are very high in potassium. Kaya hindi pwede sa renal failure. Ngayon, kung wala kang renal failure, yan yung mga sources ng potassium mo. Diba, nak? Gutom. Okay. Now, what will concern you most? Alin dyan ang pinaka-abnormal at life-threatening? Yung serum potassium, normal. Si blood glucose is slightly high, pero hindi siya critical level. Ano po ba, ma'am, ang critical level? Mga 300. BUN 20. Uy, ano pa rin? High normal, 10 to 20 kasi yan. Platelet count 20. Wow! Dapat ang platelet, 150,000 to 450,000. Pag 20,000, yan yung mag-bleed ang pasyente. Kaya that will concern you most. See? Sabi ko sa inyo, magagawa nila ng paraan para ipasok yung mga concepts. Did you get that? Yes, very good. Okay, ngayon, on reading the urinalysis, pag diabetes insipidus, what do you remember? Meron silang polyuria with low urine specific gravity. Malabnaw, water-like. How do you know na low ang urine specific gravity? Ganito yon. Mayroong 2 zero na magkatabi before a number. Yun yung sign mo na, yun yung low specific gravity. Sabi ni Ma'am Udan, may 2 zero before a number. Kasi ano bang normal na specific gravity of urine? 1.010 to 1.025. So, 1 at saka 2 ang after ng decimal ng 0. Kaya pag more than 2, kunwari nito, 3 siya and above, yan yung high specific gravity. Ito normal, ito normal. So pag ang sumunod sa 0 ay 3 and above, high. Pero pag 2 zero magkatabi, low specific gravity. So that is the answer. Letter C, kalasyaw. Wow. Ano to? Calcium, 3.8. Ano bang normal pag milliequivalents ang calcium? 4.5 to 5.5. Pag milligrams per DL, I'll give you a value. Maring may binigay na value sa inyo na iba, pero close to that. 8.6 to 10 milligrams per DL. Kaya pag calcium, titingnan nyo yung unit. Pag milliequivalents per liter, 4.5 to 5.5. Mababa. So, ano dito? Ang highest calcium content. Ang sagot, di milk. Remember, milk and milk products, kagaya ng yogurt, cheese, yan, highest in calcium content. Bago pa taho, oyster at sardines. Ang taho, oyster, sardines, rich in calcium. Pero ang highest talaga, milk and milk products. Okay? Agree na kayo para mag-top 10 kayo. Ha? Nako, wala nang problema dito. pH, mababa, acidosis. Carbon dioxide, 50, mataas, acidosis. Si bicarb, normal. Match si pH saka si carbon dioxide. Di respiratory. Hanap tayo ng respiratory. Acidosis. It's letter C. I know they teach you well in ABG analysis in top rank. Kaya yung ganyan na pinaghirapan ng iba, pag top ranker, ay nako, at a glance, alam na this. Diba, nak? Okay. Now, broadest, most comprehensive answer or umbrella effect. Ano bang ibig sabihin nun, anak? Sometimes, yung 4 choices are all correct. How to decide what is the best answer? Something that includes all the rest. Yung bang everything in it na, yung sagot na yon na kasama na yung ibang choices. Yan yung tinatawag na umbrella effect. Yun. Okay. Sige. Hypertension. Remember, hypertension is a lifelong disease. Kaya, commit to lifelong therapy. Kasama si limit stress, kasama si weight reduction, at monitoring of BP. Ito yung umbrella effect. Everything in it, it includes A, B, and C. Kaya Dallas. Ang keyword nyo kung minsan, lifelong. Yun, naku, lifestyle. Yan yung tama. You know, you could survive with keywords. Sa totoo lang. Basta, keep on practicing answer questions and you will be fluid in your performance during the exam. Kasi sanay na yung brain mo na mag-process. Do you know that we will train our brain, okay, if we repeatedly do things kagaya ng critical thinking? Sumusunod yung brain. Oo, proven yan ng research. Evidence-based yan. Okay. Useful information. Anong meron siya? Coronary heart disease. Letter A, yes. Letter B, yes. Letter C, D, yes. And letter D, lifestyle changes. That's the umbrella effect. Kasi lifestyle changes would include A, B, and C. Kaya sabi ko sa inyo, yung mga keywords na lifelong, lifestyle changes, yun ang tamang sagot. Yes? Matatandaan nyo, marami man pinagbibilin si Ma'am Udan, kala mo, oh, nakaka-overwhelm, matatandaan ko ba lahat yan? Yes, you will. You will. Okay? Because you are training your brain. Yon. Oh, test how reasonable the answer is by posing a specific situation to yourself. Reasonable ba yun? Logical ba yun? O, ganon. Ha? O, sige, application uli, framework tayo. O, meron siyang injury. Not cooperative yung mother. O, alam nyo na, abuse yan, di ba? Abuse yan. O, whenever a child is admitted because of trauma or injury, huwag niyong kakalimutan na include yung maaring abuse. Tapos yung mother, not cooperative pa. Ay nako, red alert yan. O, si attending physician, hindi siya ang nursing hierarchy mo. Charge nurse, pwede. Ang letter C, that is not reasonable. We could not refuse giving treatment to any patient, regardless of age, race, religion, sex, etc. Conduct personal interview with the child. Okay. O, 3 years old, interviewin mo. Anong sasabihin mo? Mama, dada, do this? Gaganon mo? Ha, imimuestra mo? Hindi reasonable. So, wala yan. Okay? Out siya. Streamline your choices. O, tracheostomy, inappropriate. Gamitan mo rin ng false, true or false. Ha? 3 to 5? Yes. During withdrawal? Yes. Apply suction for 15 to 20, medyo mahaba yan. 10 to 15 lang. Sterile? Yes. So ang sagot ay letter C. Why do you need to avoid prolonged suctioning? 1, you may cause bleeding. 2, you may cause vagal stimulation that will cause bradycardia and hypotension. 3, you may suction the oxygen supply of your patient. Hypoxia siya, magdi-desaturate siya. Kaya the magic keyword is, or number is 10 to 15. Do you follow, guys? Okay, very good. O, ngayon, neurovascular status of an extremity casted from the ankle to the thigh. Use your imagination. My cast from ankle to the thigh. O palpate the pedal artery of the affected leg. Pwede, kasi distal yun eh. Homan sign, can you press the gastrocnemius muscle? Hindi, nakakast. Out yan. Flex and extend the knee. Oy, kabaliwan yan. Binibeta blocker ka. Okay? Compress and release the calf of the affected leg. May cast nga eh. Diba? So, no way. So, the best answer is A. You have to do CMS, circulation motion sensation assessment distal to the cast application because it is where you could assess for any signs and symptoms of circulatory impairment or nerve damage. Kailan nasa distal? It's letter A. Very good. Okay. Now, let's have the next question. Difficulty swallowing or administering tablets by mouth. Kahit na may difficulty swallowing, the patient can still swallow by mouth. Possible pa rin. Do you open the capsule and sprinkle into the orange juice? Against sa funda principles yan. Why? If the patient cannot finish the glass of orange juice, the patient will not receive the entire dose. Out ka. As pharmacy for a liquid form of medication, do you communicate about medication with pharmacy directly? No. remember that even changing of the form of the medication needs doctor's order. Huwag kang adilantada. Ikaw na ang nagdesisyon. You have to seek for doctor's order. Ganon yun. Okay? Then give medications with soft foods like mashed banana or congee. Pwede. Diba? Crash. You might be seeing it. You might be seeing it happening in the real world, but that is not the ideal thing. Tandaan nyo, sa PNLE, kailangan textbook thing, ideal thing, Tower of Ivory. Do you follow? Wag lang yung nakikita nyo na hindi naman yun ang nasa libro. Okay? Kasi if you crush the medication, nagiging unpalatable, mapait. Baka mag-vomit pa yung pasyente. Do you follow? Yes? Okay. O ngayon, look for answers that appear different from the rest. Alam nyo, may nag-exam, sabi niya, alam mo ma'am, yun ang pinakamadalas kong nagamit sa exam, yung may naiiba talaga. Sabi niya ganon. Well, it depends on the questions that you may encounter. No? You do not need to remember all of the strategies that I'm telling you, but you will be able to use some of them, and we never know which are the some. Yes? Okay. Hypoglycemia and ketoacidosis. Ang ketoacidosis ay hyperglycemia. There is hyperglycemia. O kailan ka magbibigay ng orange juice pag may hypoglycemia? Kaya maghanap ka ng signs and symptoms of hypoglycemia. Kasi yung letter A, letter C, letter D, characteristics of hyperglycemia. Kaya ang naiba, ito, letter B. Very characteristic of hypoglycemia. Sige. Maghanap pa tayo ng mas magandang example. DVT, may spinal cord injury. You have to use your imagination. May DVT, pero may spinal cord injury. So, paralyzed. Okay? From waist down. Paralyzed. The lower half of the body. Ang Homan sign, you could check that by either pressing the gastrocnemius muscles or, you ask the patient to dorsiflex the foot. Yan. So, pain yan. Calf pain. Letter B, calf pain pa rin. Ang tenderness ay pain pa rin. Yung leg circumference, you could assess if there is leg edema. Kaya yung A, B, and C, there is similarity. It's all about pain. Ang letter D ang naiba, and it is the correct answer as well. Kuha nyo? Okay. Now, hyperkalemia. Diyos ko naman, sasabi mo, Diyos ko naman, alin ba dyan? Kung magpanik ka, hindi mo makikita, kalma lang, kalma. Tingnan mo to anak atinulol, metoprolol, timolol. Yung tatlo, puro ulol. Isa lang yung naiba, lisinopril. Boom! Tama ka. See, yung 30% probability, isasalba ka niyan. Isasalba ka niyan. So, lisinopril is inhibitor. May cause hyperkalemia. Kaya nga pag may renal failure at may hypertension, hindi binibigyan ng pril drugs. Kasi di may cause hyperkalemia. Kaya wala kang captopril na makikita, wala kang makikitang lisinopril, lahat, ramipril, lahat ng pril, bawal. Because they may cause hyperkalemia. Does it make sense? Oo, ay ganun pala yun. Yes. Follow your first intuition. Ay nako, ilang beses kang nag-regret, nagsisi, sa kapapalit ng sagot mo nung college. Kapapalit. Trust your gut or first intuition. Okay, that is usually correct. Kunwari, sabihin mo, letter A. Ay, hindi yata to. Letter B. Di rin. Letter C. Naku, manghuhulang froglet ka. The only time that you are allowed to change your answer is when you are 100% sure, 100% sure that your next answer is correct. Kung hula din lang, bumalik ka sa una. Hula, another hula, nabutas na yung answer sheet. Naku, wag na. Do not change your answer unless you are 100% sure that your answer is correct. Nakuha nyo? Yes? Okay. Oh, sige pa. When faced with a question that focuses on unfamiliar topic, remain calm. Kalma ka lang. Huwag yung, naku, ano ba to? Ito na yata, kakabagsak ko. Don't say that. Do not be calling for negative vibes during exam. Kailangan, purpose-focused. Ano yung purpose mo? To pass and top the board. Diba? Try to recall clients with problems similar to that question. Yung sinabi ko sa inyo kanina na pneumocystis jirovecii. Pneumocystis. Huh? Siguro isang klase ng pneumonia ito. You got it right. See, now you know. Bright future talaga, anak. Ay, natutuwa ako. You will be giving partly solution to our woe as nurses now. Alam nyo ba, may mga hospital na hindi makapag-open ng units. Kalahati ng hospital, sarado. Walang nurse. At eto pa si Universal Healthcare. Pangarap ni PBBM, magpatayo ng maraming secondary hospitals para hindi puro tertiary. Asthma, ilalagay mo pa sa tertiary. Pwede na sa primary yun. Pwede sa secondary or whatever. No? Depending on the severity. Magpapatayo ka ng structure. Asan ang tao? Kailangan may nurses, may doctors, may medtech and so on. Pero, aminin natin, ang pinakamarami sa workforce, sa mga health institutions, ay nurses. At pati faculty members, kulang din. Kaya, kung yung mga sinisipag dyan, magpatuloy kayo ng master's hanggang doctorate degree. Kuha nyo? Sige anak. Alam ko, mababa ng blood sugar ng iba dyan na hindi nag-breakfast. Blood transfusion, may trolley. Wag kang magpanik. Ano ba yung trolley na yan? Transfusion reaction, acute lung injury. Tingnan mo anak ha, acute lung injury. Maghanap ka pertaining about lungs. See? Sabi ko sa iyo tutumbukin mo kung ano yung specific situation. Alin dito ang tungkol sa lungs? Di shortness of breath. Nakuha mo. Kung nagpanik ka, ay naku, ano ba to? Tralili, tralala. No? Shortness of breath. Because trali is characterized by pulmonary edema. Ang galing, no? Oo, after today, super galing ka na. And you know, sa mga future na test questions na ibibigay sa iyo, mga test-taking exercises, makikita mo, may pagbabago. Mas mataas na yung scores mo. Diba? We have to increase your confidence. Kaya nyo yan. T6 to T12. Aba, basta spinal cord injury, ang isipin mo, ang issue nila na ilalagay dyan, although hindi nila outright ilalagay, implied. Basta yung mga spinal cord injury, spinal cord surgery, they may want to ask you about autonomic dysreflexia. Autonomic dysreflexia. And what is the most common cause? The distended bladder. Kaya, tumingin ka dyan sa choice. Alin ba dyan ang related sa bladder? Dito, urinary bag is full. If the urinary bag is full, the urine from the bladder cannot flow. Kaya, distended bladder. See, that's what I meant when I said rewording is the name of the game. Makakatch mo na yan. Okay, ito na siya. Neisseria meningitis meningitis. Sos, Ginoo, ang haba. Meningitis pa rin yan. At alam mo na positive Brudzinski's or positive Kernigh's. Si Chivostex, hypocalcemia yan. Si Murphy's sign, si ano yan, cholecystitis yan. Si Bloomberg, si appendicitis yan. So, kalma lang. Brudzinski's. Okay. O when in doubt as to which answer, use process of elimination. Kunwari, 4 na choices. Yung 3 maaring alam mo. Yung isa, hindi mo alam, maaring yun ang sagot. Kasi na-eliminate mo yung 3 eh. Ha? Ngayon, naman sama, pag in-eliminate mo lahat, patay tayo dyan. No? May problema tayo dyan. Ngayon, Graves, hyperthyroidism. Ano expected? Everything is high and fast. Mabilis, hypermetabolism. Weight gain? No. It's weight loss. Cold intolerance? No. It is heat intolerance. Sweaty skin? Pwede. Kasi increased metabolism. Dry sparse hair, basta dry, hypo yan. So the best answer is letter C. But don't worry. Tomorrow, I will share with you the Udan concepts so that you could differentiate hyperthyroid and hypothyroid just in 2 to 3 minutes. Ma-memorize mo lahat yung signs and symptoms. I promise that. Kaya be around tomorrow also. Ikumpleto natin. Okay, next. Hyperthyroidism, edi high and fast. Impaired, comfort impaired related to cold intolerance. Wala nga, heat intolerance meron sila. Hypermetabolism, pwede. Slow peristalsis, hindi. Kasi fast nga siya eh. Activity intolerance related to fatigue. Sino yung palaging pagod? Wala pa siyang ginawa, pagod na. Si hypothyroid yun. Kaya pag ikaw umaga-umaga, kagigising mo, pagod ka na, ala, baka hypothyroid ka or oversleeping ka. Okay? So the best answer is letter B, Baguio. Yun. Okay. Next pa anak, pulmonic stenosis. Ito. Saan ba galing ang pulmonary artery? Sa right ventricle or left ventricle? Yes, it's right ventricle. Anong nanggagaling sa left ventricle? Di aorta. Since the pulmonary artery originates from the right ventricle, di pag may stenosis, that is narrowing. Narrowing of the pulmonary artery, that is the pulmonic stenosis. Di anong meron? Right-sided CHF. Right side. So anything about breathing, left yan. So out. Ito, hepatosplenomegaly, yes. Clubbing of fingers, hypoxia yan, left yan. Hypokalemia, ano yan, RAAS activation, left yan. So ang bukod tangi na right side manifestation is hepatosplenomegaly. Medyo hirap pa konti kasi wala pa yung Udan concept, pero tomorrow, ay oo nga, ang bilis lang. Ganon. Okay? Prevention is the key concept when a question deals with infection control and in health teaching. Ganito. Ang prevention, kunwari, infection control, to prevent spread of microorganisms. Pag health teaching, to prevent occurrence of complications. Ganon. Prevention of complications, prevention of spread or transmission of infection. Ganun yung prevention. Okay? Sige, tingnan natin. Neuroleptic treatment. Antipsychotic. Remember that most antipsychotic medications may cause photosensitivity. Bawal sun exposure. Photosensitivity. Alin dyan ang related sa photosensitivity? Letter A. Itong B, C, and D, these are the nursing interventions to prevent dilantin toxicity, which is characterized by overgrowth of the gums. Okay? So B, C, and D for prevention of overgrowth of gums due to dilantin. So yung neuroleptic photosensitivity, letter A. Very good. Okay. Oh, immune compromise. Ano na naman dyan ang hindi, ang raw? Alin dyan ang raw? Green salad. Anything that is not cooked. Okay? Anything that is not cooked, raw, rewarding. It's letter B, Baguio. Ay, bright future. Namin yung correct answer. AIDS. Sino ang pwedeng i-room in? Alam nyo, isa lang naman tatanda nyo. Sino ang pwedeng magsama sa isang room? May bed A, may bed B. Pag hindi sila magkakahawaan, they will not, okay, cross-contaminate each other. O pag gastroenteritis, sus, diarrhea yan, immune compromised to. Shigellosis, dysentery yan, otro. May HIV, pwede. Pwede. Kasi cohort sila parang blood to blood. Okay? Viral pneumonia, droplet yan. Tangay ng hangin, contagious. So the best answer is letter C. Alright. O, ito pa. The grammatically correct continuation of the statement or question is the correct answer. Kunwari kung are, ganun yung the following are. Ganyan. O di, plural din yung verb mo doon. So yung plural na verb, walang S. Ganon. Alright. Now, all, always, everyone, ever none are global words. View it with caution because there as if there are no exceptions. Kaya parang hindi tama. Most of the time, hindi tama. Tama. May pagkakataon na maaring tama pero very rare. Yung mga always, all, everyone, never, none na yan. Yes? Okay, gutom na ba kayo, anak? Lapit na. Now, take the necessary time for each question without spending too much on any one item. Ma'am, ano po ba ang rule of thumb? Ang rule of thumb is the maximum time. The maximum time that you devote for one question is 1 minute. Maximum yun. Meaning to say that you should be able to answer a question less than 1 minute. Para kung kunwari may mas mahirap computation, may na-save ka na seconds or minutes, pwede mong i-donate yan sa question na kailangan na medyo mas mahirap o kailangan ng maraming time. Because your tendency is, if you linger on a question, naglilikot na naman yung brain nyo. You will be adding to the question again. Nagkakaroon ka ng visual hallucination. Wala naman sa question, nalalagyan mo na. That's what I meant by visual hallucination. Kaya, do not linger in one question. Yun ang ibig ko sabihin. Masyado nang marami na namang dagdag bawas. Don't pay attention to how quickly others complete their examination. Uy, yung mga taga-ibang review center, tapos na sila. Abe, malay mo, baka wala naman siyang maisagot na tama, napagod na lang siyang mag-isip, give up na, di ba? Yung galing sa top rank, maraming concepts, binigyan pa ng critical thinking strategies. Ay di, basta wag kang ma-overtime. Kaya nga, sabi ni ma'am, basta maximum time for each question is 1 minute. If you study to the master level, anak, you would not even need 1 minute. Nagmumurang katotohanan yung mga sagot. Promise. Okay. Helpful strategies and hints. Success is the sum of small efforts repeated day in and day out. So hindi pwedeng big jump kaagad. Yung ano bang big jump? Di yung cramming, mag-aaral ka lang, 1 or 2 weeks before the exam, asa ka pa. Di ba? Dapat araw-araw, anak, magbabasa ka, mag-aaral ka. Kung busy-busy talaga, kahit mag-aral ka pa rin, kahit 1 or 2 pages lang ng notes mo. Huwag mong palalampasin sang araw na total hindi ka nag-aral kasi you're breaking the synapse. Naging habit mo na eh, na-break yung synapse. And remember, the hardest thing to do is to start. Pag medyo natigilan mo ng 1 or 2 days, ang hirap mag-umpisa. Kung ano-anong ginagawa mo, tayo ka ng tayo, kung ano-anong mga naalala mong gawin. Di ba? Whereas kung araw-araw mong gawin, part ng system mo, you even look forward to studying. Oo. O, di ba? Future mo yan. Ni-imagine ko, lalo na yung mga boys dyan, nasa Amerika, nag-drive ng Lexus, Mercedes. Pero ayaw nila Mercedes, pang matanda daw eh. Cayenne, yung Porsche, naku, Lambo. Alam ko yung mga boys, malaro sa mga kotse yan eh, mahilig. I have 3 boys actually. Kaya, naku, bata pa sila. Nagni-name na sila ng mga kotse na nakikita nila. Oh, that's a Ferrari. Ganun sila. Oh, that's Maserati. Hindi ko naman naintindihan yung mga yon. Oh, that's a Lambo. Pero tingin ko, Lamborghini nga talaga. Ang boys, talagang bata pa sila. Alam na nila yung mga kotse-kotse na yan. Okay, before anything else, preparation is the key to success. Sabi ni Alexander Graham Bell. Sino ba si Alexander Graham Bell? He was the one who invented the telephone. Kaya yung cellphone na yan, galing pa rin yan sa basic na telephone. Can you imagine, galing yan, no? I remember nung bata kami, yung lata na may string, yung hello, hello. I don't know, you guys do not have the time for that anymore. Kasi parang lahat nasa device. 2 years old, may iPad, may cellphone. O, di ba? Nursing examinations emphasize the ideal practice of nursing based on textbooks and theories. Yun yung sinabi ko sa inyo. Not what you see in the real world. Sometimes hindi yun yung tama. Kagaya ng pag-pulverize ng medications. Tapos lagyan mo ng water, ipainom. No. Ipopulverize mo lang ang medications pag NGT feeding, gastrostomy feeding, enterostomy feeding, pwede. Pero kung oral, do not. Okay? O imagine that you are actually taking care of patient as you go about answering his question. Kagaya kanina, the patient has cast from the ankle to the thigh. Inimagine mo yun. So how could the patient flex the knee? Diba? Ganun lang yun. Imagine. When dealing with questions regarding Theracom, we will deal with it after your break. Sige, you deserve a break. Ilang minutes ba, Sir Ron, ang break? Sir Ron? Ay, nilayasan ako. Ay.
Hello po, ma'am.
Ilang minutes ang break? 30?
Sige po.
Hindi,
30
ano ba
minutes.
ang policy?
15 po.
Yes, ma'am. Ma'am, 30 minutes po tayo.
30 minutes po.
Naman, bababa pa lang ako para gumawa ng coffee. 10 minutes na yun. Wala ko elevator sa bahay, no? Sige. Okay. See you later, alligator.
Thank you po,
ma'am.
Thank you. Okay, guys, break is over. All right, so let's resume. And this time it's about therapeutic communication. You know, it's not only in psychiatric nursing where questions on therapeutic communication appear in the exam. It is threaded in all topics. Number one rule in therapeutic communication is focus on feelings. If we focus on feelings of people, they would feel that we have entered their inner thoughts, their inner world, and they feel secure with us. They trust us. Okay? Eliminate the following. Choices that evoke authoritarian responses like, I am your nurse. I know what is best for you. That's not a theracom. Questions answerable by yes or no or why questions. Because if the question is answerable by yes or no only, it does not allow the patient to elaborate fears, feelings, concerns. Why question may be felt as a probing question. And it may be too difficult for them to think of a reason. Okay? Don't worry response and nurse-centered responses have to be eliminated, as I have mentioned early on. Now, the application in the framework. The bugs are crawling under my skin. What is your appropriate response? In letter A, you are agreeing that such sensation happens, okay? Letter B, you're focusing on feelings. Usually the content hallucinations are scary. Letter C, you are refuting the hallucination. It will intensify anxiety, and the more that the patient will deal with his hallucinations. Same with letter D, that is also refuting the patient's hallucination. Okay, present reality. Next, appropriate theracom for the client. The client is agitated. Is it A, B, C, or D? Focusing on feelings, tell me when you feel anxious. In letter D, you are putting the patient into the defensive. Same with letter B. Now letter C, that is threatening a client, okay? If you do that again, you will be left alone in your room. And threatening a client is tantamount to patient abuse. Be careful with that. So it's letter D, Dallas. Next, what will be your best reply? Letter A is answerable by yes or no only, eliminate. Letter B, the patient would not even have any answer for that statement. Letter C, that explores the patient's feelings. And letter D is also answerable by yes or no. Would you prefer a female nurse? So it's not therapeutic. So the best is still is letter C, feeling pa rin. Okay? Now, let's have the next questions. Sorry, with questions regarding positioning, ask yourself, is this prevention or promotion? Then consider anatomy and physiology next. Okay? Now, the child has been diagnosed with myelomeningocele. In which of the following positions does the nurse best place the child? Remember that in myelomeningocele, there is a sac at the back, lumbosacral region. We would like to protect it from trauma. So the best answer is prone position. It's letter B, Baguio. Now, during, you know what? When it comes to procedures, you have to find out what is the tense. Is it during or is it after? Because That will matter with the correctness of your answer. So, thoracentesis concept. After thoracentesis, place the patient on the unaffected side to prevent leakage of fluid into the pleural space. The general rule is after a procedure that involves puncturing, like liver biopsy, kidney biopsy, we place the patient towards affected side to apply pressure and prevent bleeding. But in thoracentesis, it's more on unaffected side. Okay? So the best answer is, oh wait. It's during, I'm sorry. Sitting upright, leaning forward, if it is during. So it should be sitting upright, leaning forward. I just place pictures here to help you do the imagination. Ha? Kayo ha, kung ano sinabi nyo dyan. Sitting upright. Okay, next slide please. Cystoscopy. Answer, lithotomy position. So this is how lithotomy position is done. Okay, so for cystoscopy, lithotomy position will undergo renal biopsy. So during, where are the kidneys? At the back. So to expose the back, the patient should be in prone position. So you have to find out what is the question asking. If it is during, prone. If it is after, supine, to apply pressure at the puncture site. But this time the question is during, so your final answer is letter C. Now, another issue that you may encounter in the exam is prioritization. Because once you're working in the clinical floor, this is something that you need to do every minute of your decision making. What are the strategies? When it comes to prioritization questions, give priority to life-threatening conditions. I-translate nyo yan simply. Alin dito ang nakakamatay now na? Yun yung mauuna. O, see? Simplihan mo. Attend to problems identified by the patient first. Ano ba ang chief complaint niya? Difficulty of breathing ba? Mataas ba ang blood pressure? Sumasakit ang tiyan? Or nagsusuka? And you have to prioritize that. Patient before equipment. Always patient before equipment. Okay? Now, unstable patients before stable. Your knowledge in pathophysiology will tell you which of the patients given in the choices is unstable. Time constraints and available resources. Remember the principle of utilitarianism. The greatest good for the most number with the least harm. So if a patient will use up all your nursing time and resources, that may not be the highest priority. Don't get me wrong. No patient will be neglected. But if you deal with patient who will be exhausting all your nursing time and resources, you might not be able to care for a greater number of patients. So a greater number versus one. Okay? Just like, for example, if a patient had CVA in coma with fixed dilated pupils, if you give priority rather to that patient, or you go to that patient first, you will be with that patient who is wholly compensatory, according to Johnson. OREM, I should say, OREM. Wholly compensatory, you have to do everything for that patient. Supposing you have 10 patients, You went to that patient and you neglected 9 patients. That's what I'm trying to say. You have to give each patient nursing care time justly. Okay? So, the fixated pupils, kaya mo na yan. Wala nang chance mabuhay. No, we don't say that. We still care for that patient, but certainly not the first that you will go to. Okay? Then use Maslow's, always physiologic before psychosocial needs. Okay? So between a patient who's having difficulty of breathing and a patient who is in panic, screaming, you go to the one with physiologic problem first. Then consider the use of ABCs. Patients who have problems with airway, breathing, circulation will be given highest priority, especially airway, because our body does not store oxygen. We need a continuous supply of oxygen. And patients with airway, breathing, circulation problems may be rewarded in so many times. You have to catch that, okay? Nursing process. The first phase is assessment. So if you are asked, which of the following is your first nursing action? Usually, the choice where you are doing assessment is the correct answer, unless there's already adequate assessment in the situation. That's the only time that you will choose something about implementation. Usually, assessment first. Always remember, guys, safety is always a priority. Patients who are at risk for falls, patients who are at risk for suicide, these are safety issues and therefore should be given highest priority. Actual before potential. How would you know that it is a potential problem? There's usually the phrase high risk for. High risk for potential. So it should be actual before potential. Okay. The application framework. Highest priority. Is letter A fatal? No, that is a characteristic manifestation. If a depressed client suddenly has alteration in behavior, mood, then that is an implication of high risk for suicide. So this is a safety issue. Letter C, well, that is a characteristic manifestation, not really a safety issue. Well, schizophrenic client who refuses to take a shower, that is not also a safety issue, okay? So the best answer is letter B. This connotes suicide. It connotes suicide. Now, whom do you see first after the receiving end of shift report? Look at this, letter A. There's no positive outcome. Analgesic was given 2 hours ago, and yet the pain is still severe. That's what 8/10 means. Okay, now 20 units of regular insulin, the blood sugar is now down to 120. It's okay. Transfusion being monitored, it doesn't say any active problem at the moment. Glucose in the urine, if the patient starts with TPN, is expected. So the best answer is letter A. There is no positive response to the nurse intervention. Something wrong might be happening. Okay, do you agree with me? I know you will. All right, highest priority again. Well, swelling is expected when you lower. Oh, I'm sorry. When you lower the feet, of course, that's expected. So not a priority. No bowel movement, it's uncomfortable, but it's not really that fatal. Numbness under the cast, that connotes compartment syndrome, problem with circulation. ABC is a priority. And then complaints of itchiness, well, itchiness will not kill. So it's letter C. Do you agree with me, guys? I know you do. Now again, prioritization question. If the patient is manifesting signs and symptoms expected of that diagnosis, not a priority, it's expected. Something that would tell us that the patient is having a complication of the condition, that will be a priority. Just like letter C, fatigue after feeding, that is severe hypoxia. Okay? Letter A, expected. Letter B, expected. And letter D, expected. Not priority. It's letter C. Now, whom do we assess first? Well, hemoglobin 7. Why? This is the level of hemoglobin when the patient will already require blood transfusion. Cholesterol of 280, well, it does not kill instantaneously. WBC of 13,000, the patient is having infection, but between problem with oxygenation and infection, problem with oxygenation should be given priority. COPD, autosat 90%, that is normal. I know the normal autosat is 95 to 100%, but in COPD, they are breathing because of low oxygen levels in the blood. So expectedly, their autosat is below 95%. So not a priority. So I repeat, it's letter A. Very good. Okay, again, another prioritization question. I told you, letter A, the patient would use up all your nursing time. Letter B, pallor and pulselessness, compartment syndrome. Again, problem with C in the ABC, circulation. Then fracture of radius, it doesn't say anything as an active problem, as well as in letter D. I will go for letter B, compartment syndrome. If it is not resolved within the first 12 hours, there will be irreversible deformity. If it happens in the legs, irreversible foot drop. If it happens in the arm, irreversible wrist drop. So it's a priority. It's letter B. But if you don't have the strategies, you will be tempted to answer letter A. Tell me honestly, di ba? Okay. Now, again, letter A, you know what? Patients with anorexia nervosa do not have the plan to die. They just want to be thin. So out. Letter B, it's not life-threatening. It's not even a safety issue. In letter C, this is a red alert that the patient may act out any time. Look at the angry facial expression and holding hands in fist. Okay, and number 24, well, that's not life-threatening. So it's letter C. It's a safety issue. Now, highest priority again. I would go for letter A. Why? Antidepressants usually take effect at a minimum of 1 week. A minimum of 1 week. So if it is just 3 days ago that the patient started with antidepressant like Prozac, that's not the effect of the medication yet. And I told you that if there is any change in the behavior, in the mood of a patient, okay, with depression, that is suicide risk. Patient on lithium with serum sodium of 129, he will be okay. Same with letter C and letter D. There are no immediate safety problems. It's in letter A, suicide. Now learn to recognize expected outcome. Expected outcome. Let's have examples. In MI, the expected outcome is there should be immediate relief of chest pain because that connotes adequacy of oxygenation of the myocardium. What makes letter A incorrect is minimal chest pain. This implies that the patient's heart is not receiving adequate oxygenation yet. Discussing about risk factor is too early. The patient does not have the energy to discuss yet. It's only second day of hospitalization. Cardiac rehab could be discussed later. And then no chest pain, the key word is no chest pain, so it's letter D, Dallas. Okay? Now, arthritis. In arthritis, the expected outcome would be to be able to perform activities of daily living, because that is the one that is greatly affected. So I will go for letter A. Full range of motion in joints may not be attainable anymore. There will be some degree of limitation. Okay? So it's letter A. Because it's important that a person will be able to perform self-care, activities of daily living. Anorexia nervosa, effective management implies that the patient is now eating. How do you know that the patient is now eating? Letter C. The client does not drink water during meals. Why? The observed behavior of patients with anorexia nervosa is while eating, they keep on drinking so that they will feel full and they have the excuse not to eat. Okay? Weighing every morning, she's still very conscious of any weight increase. Okay? Exercises 3 hours a day. That's still too much. She is in the acute phase of anorexia nervosa. Visited a friend. Okay, well, she's looking for cohort and they will be talking about their abhorrence to eating. Okay? So I would go for letter C. It means that they're now eating. Another strategy that I would like to share with you. If clusters of data are in a choice, go vertical. Pag ganito, vertical. Huwag pa ganon. Marami kang masyadong kailangan tandaan. So chronic renal failure. You know that the diet will be high calorie, low protein, low potassium, low sodium. How do we go vertical? Mauna muna ito. Salted eggs, out ka na. Kasi high sodium yan. Shrimp, sauteed in butter, out ka na. Kasi high sodium yan. Anything that comes under the sea. Hamburger, oh, this is high protein. Okay? Steamed mixed vegetables, pwede. So the rest, hindi mo na kailangan basahin yung iba pa. Kasi first pa lang na item, out na. But let's read letter D thoroughly. Mixed vegetables, lean beef, protein of high biologic value, and rice. Pwede. It's letter D. That's what I meant by, go vertical so that you could streamline your choices. Choosing between 2 rather than among 4 is a lot easier. Do I make sense, guys? Okay. Now, disequilibrium syndrome. This is characterized by increased ICP. Now, restlessness, yes, retain. Nausea and vomiting, yes, retain. Lethargy, it's more on restlessness, out. Tachycardia, well, increased ICP is characterized by bradycardia, slow bounding pulse, out. Now, between these two, is it hypotension or hypertension? It's hypertension. When it is renal disease, it's hypertension. So the best answer is letter B, but there's some more. Supposing you don't remember that this equilibrium syndrome will lead to increased ICP. Use another strategy. Something that is different is the best answer. Look at this. Letter A, hypotension. Letter C, hypotension. Letter D, hypotension. Ang may hypertension lang itong letter B. So that's a 30% probability of still getting the correct answer. But the best is the 70%, diba? And of course, 70% knowledge-based, and 30% strategies. The perfect combination. Now, prednisone. You know that steroids retain sodium, so it has to be low sodium. So itong dalawang high sodium, out na. Now, patients on steroids lose potassium, kaya dapat high potassium. They break down fats and protein, kaya kailan high protein. So, the best answer, diet for a patient on steroid, low sodium, high potassium, and high protein. It's letter A. That's the perfect combination. Select all that apply questions or arrange in sequence questions are other types of questions in the exam. So let's try that. So high in potassium, apple is not. So anything with one, crash. Letter C, crash. Letter D, crash. So what remains will be A and B. Banana, yes. Orange juice, yes. Strawberries, no. Strawberries also have low potassium. Kaya sa renal failure, pwede ang strawberries, pwede ang apple. Yun. Okay, tomatoes, yes. Watermelon, yes. So, 2, 3, 4, 5, 6. 2, 3, wait a minute. Strawberries, no. 2, 3, 5, 6. 2, 3, 5, 6. Yeah. Tao lang. 2, 3, 5, 6 is letter A. Thank you. Now, peak flow. Inhale deeply, then blow air because it's exhalation that we are measuring. That's why in letter number 2, no way. So 1 is yes, 2 no. A good control, yes. Number 3, yes. Number 4, yes. And number 5, yes. So the only one that you will check is number 1. Let's look into the choices. Should be 2, 3, 4, and 5, 6. 2, 3, 4, 5, 6. 2, 3, 4, 5, 6 is, ay, bakit puro letter A? This should be letter B. Mea culpa, this should be letter B. 2, 3, 4, 5, and 6. Okay? Did we understand that, guys? Oh, NGT. NGT, arrange in sequence. What do you do first? Place client in sitting position. So number 2. Sulat nyo, number 2. And then, measure. Number 1. And then lubricate. Number 4. And then gently insert. Number 3. Then check placement. Number 6. Huli yung number 5. Tape the tube to the bridge. So, tulungan nyo ako. Ha? Anong number dito? Is it 2? Can you key in your answer? Two, 1, 4, 3, 6, 5. Oh, thank you so much. Ay, ang ganda. May kausap ako. Thank you for listening, guys. It's for your future. Oh, next, arrange in sequence. Oh, opening a sterile pack. Oh, sabi ko sa inyo, pati basic eh. Una, number 4. Eh, lahat naman ito, number 4 pusa. Sunod, number 3. And then, sunod, away. Number 5. Sunod, to the side. Asan ito sa 2? Ang huli, away. Number 5. And then, put the pack in the sterile field. O, yan mo na, i-drop mo na sa sterile field. O, anong letter yon? Tulungan niyo ako. Okay? 4, 3, 5, 2, 6, 1. Oh, thank you so much for your great help. I appreciate it. All right. So, I've been telling you for the nth time, rewarding is the name of the game in PNLE. They would try to give you a concrete example of a certain term. You have to catch that. Matututo kayo. So, IA PEPA. Whenever it is abdomen, IA PEPA. Inspection, auscultation, percussion, last is palpation. And this time, inspection is rewarded as observation. So, saan si IA PEPA? It's letter B, Bronx. Okay? Will undergo lumbar puncture. Remember that when the ICP is high, they may not proceed with lumbar puncture because of the danger of herniation of the brain. So which one is rewarding of increased ICP? Headache. It's headache. Fever, pressure sore, or inability to move legs will not contraindicate the performance of lumbar puncture. So letter A connotes increased ICP. Now, lithium. Lithium is antimanic. How do you know it's effective? When the patient's concentration ability is greatly improved. When the patient's concentration ability and attention span is greatly improved. Ano ang rewarding niyan? The client is able to attend the conference on time. So, hindi na siya nagmamanik masyado. It's letter C. Okay? Head injury. You have to reduce environmental stimuli to prevent seizures. Reduce environmental stimuli to reduce seizures. So it's about turning on TV. This may trigger seizure. It's California. Then we go to priority. I would still go for letter B. That is compartment syndrome. ABC is a priority. Okay, 265 is not critical level yet. It's 300. Yung terminal, bakit? Ilan pa bang breathing ang gusto mo? Makontento ka na, humihinga pa, 14 pa. Ha? Complaining of headache, well, this is increased ICP. However, medical care would do for that, just like mannitol and so on. Okay? So I would go for letter B. It's problem with ABC circulation. Chest pain was a priority. Check vital signs before you notify the physician. Letter C, why are you diagnosing? And letter D, it does not say in the statement that the patient has sublingual nitroglycerin or DERD. So it's letter A, assessment first. All right, diet with diverticulitis, outpouching in the large intestines. The concept is no nuts and seeds. No nuts and seeds, they may be trapped in the outpouching. So saan dyan yung hindi naman kinakain ang buto? Oranges. Tomatoes, cucumbers, strawberries have seeds. Diba? Ang strawberries sa labas, yung seeds niya yun. Okay? May seeds ang strawberries. Yun nga lang, nasa outside. Alright. So oranges, hindi mo nilulunok yan normally, yung seeds. Alright. For racine, there is a keyword, taking for a walk. You know that racine is antipsychotic and it may cause photosensitivity. Basta taking a walk, photosensitivity ang i-relate nyo. Kaya letter A. It's letter A. Do you follow, guys? Good. All right. So, That's done. Ability is what you're capable of doing. Motivation determines what you do. Attitude determines how well you do it. Okay? So general study tips. Make a timetable. So kumuha ka ng calendar o mag-download ka sa calendar. Lagyan mo na yung schedule mo, i-post mo where you usually are at. Sa bedroom, sa dining room, ultimong sa kitchen, ay sa toilet, para nakikita mo, pala, gagawa pala ako ng 100 questions ngayon. Set the best time for studying. May mga morning people, may mga evening people, may early morning people. Wala naman siguro yung people na walang time mag-aral pag preparing for the board exam. Di ba? Silly, Mama Dan. Write and post your schedule, as I've said, para hindi mo nakakalimutan. Get organized. Do you know that successful people are people who usually things to do list? Oo, na-find out yun. Things to do list. Yung may post-it pa, nilalagay. Things to do, 1, 2, 3, 4. Kaya pag accomplish, check. O, di ba it gives a feedback? Masaya. Marami kang na-accomplish. O, yan yung sinasabi ko, mag-download kayo. O, lagyan nyo na schedule. Yan. Choose a place conducive for studying. You know what, guys? The bed is never a conducive place for studying, conducive for sleeping. Pwede. Saan ako usually nag-aaral? Aside from yung aking office table, doon ako sa dining table. But kung minsan pumunta ako sa dining table, maluwag maluwag. Lahat ng gusto mo, nandyan yung pen mo, nandyan yung ruler mo, nandyan yung highlighter mo, nandyan yung stapler mo, nandyan lahat. Hindi ka tayo ng tayo, di ba? Pero wag kang kain ng kain. And then, device mnemonics. Yun na nga, yung 12 cranial nerves, OOO, to touch and feel, etc. Ako naman, kumisan, ang ginagawan ko ng mnemonic, yung what does it mean when? What does it mean when the ventilator alarm turns on? I use the mnemonic hold, H, high pressure alarm on, O, obstruction, L, low pressure alarm on, D, disconnection. Yan. So hindi ko na papagbaliktad. Ano na nga yung high pressure alarm tsaka low pressure alarm? Hold. Low pressure alarm turns on obstruction. Low pressure alarm turns on disconnection. O, di ba? Bala ka kung ano yung madali mong ma-memorize. Baka naman sa dami ng mnemonics, wala ka na matandaan sa mga mnemonics. Practice test taking every single day. Because we are painstakingly preparing the questions. Hindi lang yan copy-paste. Talagang pinag-iisipan namin yan. Stick to your schedule. Huwag kang pasaway. Yung mga friends mo, pwede mo naman i-request kung talagang friend mo. Galit-galit muna tayo, hanggang ganitong petsa. Kailangan kong pumasa ng exam. Pag kinakantsawan ka, sasabihin mo, sige, pag di ako pumasa, hindi ako makapunta sa Amerika, hindi kita mababilhan ng shoes. Di ba? Motivation. Learn how to say no. At saka pag nag-aaral kayo, huwag ninyong katabi yung cellphone. Ting ng ting yung cellphone mo. Tapos, mamaya mas marami ka pang time sa cellphone, nasa same page ka pa rin, naka 1 hour ka na sa cellphone. Promise, talagang yan, i-silent mode mo muna. Ngayon, syempre, sa stage ninyo, karamihan sa inyo, majority siguro, may girlfriend, may boyfriend, whatever. Kakausapin nyo. Kasi may mga girls na demanding Why are you not responding to my pahatid sundo pa, layo-layo ng bahay? Kausapin, alam mo, please help me create the environment for me to pass this exam for our bright future. Kasi sinabi ni Ma'am Udan, Pag mahusay na akong nurse, makapasa ko ng mga exam sa ibang bansa, kayang-kayang kitain yung $500,000. Mga $10,000 lang naman yun. $500,000 every single day. Hindi yun buwan. Araw, anak. Araw. O, kung magtrabaho ka ng 3 araw sa isang linggo, magkano na yon? Hindi mo kakayanin magtrabaho ng 7 days a week. Maaga kang mamatay. Kakayanin kasi bata pa kayo. Pero lahat ng ka-estresan. Kaya you have to preserve your body. Self-care din. Kasi yung natirang araw, edi maglinis ka ng bahay. 'Di ba? Mag-laundry ka. Hindi yung bahay mo parang hardware na or whatever. Ha? So, ganoon, kausapin mo. Prepare ako sa future natin. O, pag yung mga girls, sabi ng boyfriend, pag hindi mo ako sinasagot sa phone, sa cellphone, break na tayo. Aba, pumayag ka sa break. O di, sige, break, go tayo, break tayo, and you will be losing a diamond because I'm a diamond. Ganern. Di ba, anak? O, ganun talaga. Kasi, if that person truly loves you, cares for you, ano yan ahayaan ka to soar like an eagle. Isusupport niya. Na yung focused ka sa may direction sa mga goals in life. Kasama mo siya sa pag-abot. Hindi siya barrier or deterrent. Oh, you better listen to me. Kasi kung minsan puro lang kayo hormones. Ha? Oh, sige. Tapos, pag pumasa ka, reward yourself. Buy yourself something, yung from me to me, ganun. Kunwari, gustong-gusto mo ng, ano na ang tawag sa ganitong phone, ganitong watch, yung Apple Watch. O, gusto mo ng ganito, o di bilhan mo sarili mo, pero may Android ito, mura lang. Nainis ako kasi yung friend ko nakabili ang ganun. Ang mura-mura lang, 3,000. Sabi, kaparehong ano ba yan? Pero hindi bale. Diba? O, bala kayo, yung mga boys, pag sabi, I will buy myself a car. Go, sige, pag-ipunan mo anak. Pero yung attainable lang naman, yung immediate lang, yung short term. Tsaka na yung mga long term. Yung short term, kunwari, I will do my hair and my nails. Yun. O kaya, we will dine out sa restaurant, sa ilang restaurant, sa baba ng Manila Hotel. O minsan mo lang gagawin yun. Diyos ko, ordinaryo na yung pagpunta mo ng Jollibee, Chowking, at kung ano-ano. Something special naman where you will dress up, pasosi-sosi. Ganon ang mag-enjoy sa buhay. Kasi for being good ka pumasa ka di ba? And I tell you, minsan I was so touched. Sabi nung isang pumasa, boy siya, male, sabi niya, alam mo Ma'am Udan, umagang-umaga, hindi pa ako nagising. Tinalon ako ng father ko na in-embrace, umiiyak. Never akong niyakap ng father ko sa buong buhay ko. Kasi yung tatay ko, police ma'am, masyadong parang wala sa bokabularyo yung hug o kaya hindi man lang ako nasabihan niya na I love you ni minsan. Pero nung pumasa ako, tinalon talaga niya ako na umiiyak siya, I love you anak. Sabi ko, nakakaiyak naman. Di ba pag ang tatay umiyak parang iba? Pag yung nanay ang umiyak, dramatic actress naman talaga kami mga nanay, di ba? Mga best actress kami. Pero pag ang tatay ganun, yakapin ka, umiyak, mag-say ng I love you, that's worth than a million. O, di ba? Make your loved ones happy. O, yung mga married dyan. O, pati asawa nyo, nagtitis sa open the can. Wala ka nang ginawa, kundi open the can kasi nag-aaral ka. Anong open the can? Corned beef, tuna, sausage, lahat na lang, open the can. O, di, i-treat nyo sila. Kasama ka na sa reward. Palagi, if you do good thing for yourself, reward. Kasi masaya you will get motivated. Diba? Ganun yun, anak. Learn how to, be happy in your lives so that you could serve longer and better. Yung bang matagal ang buhay mo. Diba? So, confidence, performance, success. And believe everything is possible for him who believes. I will pass. I will top the board. Oh, with God, everything is possible. Oh, let's read together where you are at. Baguio, Marikina, Manila, Quezon City, Zamboanga, Davao, Tacloban, Samar, wherever. If my mind can conceive it and my heart can believe it, I know I can achieve it. Diba? Two things define you. Your patience when you have nothing, and your attitude when you have everything. Be humble. Learn how to share to the less fortunate people once you have a lot. Ganun yun. Okay. It is attitude, not aptitude, that will bring you to altitude. Oh, si Walt Disney, all your dreams can come true if you have the courage to pursue them. Thank you. Wow, ang galing. Natapos natin. Ilang questions yun? Marami din yun, ha? Oh, yung MS Critical Thinking Drills, bitin kasi kung ngayon natin gagawin. Gusto ko dire-diretso din yun. Sir Al. Hello?
Yes, ma'am.
Naibigay na ba sa kanila yung ano? Ano bang available na bigay natin sa kanila?
Materials po.
Yes. Yung MS drills ba na ibigay nyo na sa kanila? Kasi may ano pa tayo eh. May...
Alam ko
Ma'am,
ma'am
meron na.
napadala na.
Ha?
Meron na po, ma'am. Tapos.
Pwede sigurong umpisang konti. Pero napaka-iksi. Teka, try ko lang ha. Where is that? Sige, pwede nating umpisan to siguro. Ay, asan na ako? Ba't nawala ako? Ba't nakapatong-patong tong akin? Asan na yung screen
Alam ko
share?
na ilagay na sa G-Class. Pabilis niyo po ma'am.
Share screen. Naka-share na ba ako?
Opo, ma'am.
Teka, full screen natin. Meron sila nito? Word
Yes,
form.
ma'am, meron po.
Okay, guys. Let's start with the MS Critical Thinking Drills. This is the one that I was trying to promise to you, that in 2 to 3 minutes, you can analyze signs and symptoms of certain diseases. Kasama pa kung minsan pati interventions. Okay? Let's start with this para bukas hindi tayo ngarag sa oras. Ha? All right. Remember that still the #1 killer of Filipinos is cardiac disorders. So, it may imply that there is great probability that they may ask you about MI, angina pectoris, congestive heart failure, hypertension, and so on. Now, I designed this specifically for select all that apply questions, or maybe single answer multiple choice, para hindi kayo hirap na nagme-memorize. And then pagdating ng after 2 days, nagkanda, gulo-gulo na naman, halo-halo na naman. Ganito. Let's start with the concepts in congestive heart failure. Ano yung Udan concepts? Sa right-sided say Chef, you remember 2 concepts, venous backup and systemic manifestations. You may write this in index cards. Left-sided say Chef, there are 3 concepts to remember, left lungs, cellular hypoxia, and RAAS activation. Yung RAAS activation na yan, madali lang i-memorize. Hypertension tsaka hypokalemia. If I just present it to you as is, it will not mean anything, but I will attempt to explain to you how I came up with these concepts. Remember, congestive heart failure happens when the ventricles are unable to eject blood as fast as blood enters the atria. So in congestive heart failure, it is the ventricles which are in failure. Now, let's start with right-sided congestive heart failure. When the right ventricle is unable to eject blood as fast as blood returns to the right atrium, what happens? The blood re-entering the right atrium via the superior vena cava and inferior vena cava will not be able to transport the blood back to the right side of the heart. So there will be accumulation of blood in the venous channels. You call that concept as venous backup. Just to give you an example, if the venous blood from the upper parts of the body could not re-enter the heart via the superior vena cava, there will be jugular vein distension or distended neck vein. If the venous blood from the lower parts of the body cannot re-enter the heart via the inferior vena cava, what happens? You know that the venous blood from the lower parts of the body will have to pass through the liver first before it goes back to the heart via the inferior vena cava. So what happens is blood accumulates in the liver, causing hepatomegaly. If there is hepatomegaly, blood from the portal vein cannot be transported to the liver. So there will be accumulation of blood in the portal vein, which we call as portal hypertension. Now, if there is portal hypertension, the spleen cannot transport blood to the portal vein, causing splenomegaly. This explains why the consequence of hepatomegaly is splenomegaly. Magpartner yan. And remember, when the liver and the portal vein are congested with blood, plasma shift out. And the fluid or plasma will accumulate in the abdominal cavity, causing ascites. You know that the primary function of spleen is to do hemolysis. Hemolysis, that is destruction of old blood cells. Sabi ni spleen, oy blood cells, matanda na kayo, destroy ko na kayo. In splenomegaly, even the young blood cells are included. Okay, because they are trapped in the spleen, they're included in the hemolysis. That's why the consequence of splenomegaly is hemolytic anemia. So ayan, hepatomegaly, splenomegaly, hemolytic anemia, ascites, portal hypertension, they happen below the chest. That is affecting the body below the chest. We could give that a concept of systemic manifestations. That explains the two concepts in right-sided CHF, Venus back up and systemic manifestations. Now, let's go to the left side of the heart. If the left ventricle is unable to eject blood as fast as blood returns to the left atrium, congestion in the left side of the heart will make the lungs unable to return the blood to the left atrium. So when blood accumulates in the pulmonary capillaries, plasma or blood will enter the intraalveolar and interalveolar spaces. And you call that as pulmonary edema. But let's simplify it for better memorization. Whenever it is left-sided CHF, signs and symptoms pertain to the lungs. Kaya left lungs. It makes sense. When the lungs are affected, very little oxygenated blood goes back to the heart. Kaya hypoxia. Magkadugtong yan eh. Left lungs, hypoxia. And one of the natural responses of the body to chronic hypoxia is RAAS activation. What is RAAS? Renin, angiotensin, aldosterone system. Ano ang nagaganap dyan? Okay. Whenever there is chronic hypoxia, the kidneys will secrete the hormone renin. Once renin is secreted, this will trigger the liver to produce angiotensinogen. Once the liver produces angiotensinogen, the lungs will produce angiotensin converting enzyme and will convert angiotensinogen to angiotensin 1. But ACE or angiotensin converting enzyme will work further so that angiotensin 1 will become angiotensin 2. What are the two actions of angiotensin 2? 1. Arteriolar vasoconstriction. 2. It will trigger the adrenal cortex to increase aldosterone secretion. And if there is increased aldosterone secretion, there is increased potassium excretion. So that explains the hypokalemia in RAAS. Arteriolar vasoconstriction will increase BP. That explains the hypertension in RAAS. So bottom line, the two concepts for right-sided CHF, venous back up systemic manifestations. The three concepts in left-sided CHF, 1, what's the first one? Left lungs. Number 2, hypoxia. And number 3, RAAS activation as manifested by hypokalemia and hypertension. Ganon. Okay. Sorry, tapos ko na to. Now, I will help you with the first two. Bakit ba 1 and 1 to? And then, I give you time to do the rest. Because I want you to become independent learners. I will push you a bit, pero yung talagang todo, kayo na. Ha? Oh, distended neck vein. Is this right or left? Right. What's the concept? Venous back up. Itong bipedal edema. Bakit may edema ka dun sa legs? It's also venous back up, so it's right-sided si Chem. Now, you do the rest. You write RS for right side and LS for left side. I give you 3 minutes and then we do them together and you will be amazed with how good you are when it comes to using Udan concepts. Sige, go anak. Okay, let's answer. You can key in the chat box your answers. Orthopnea, left lungs. Rolls and crackles, left lungs. Ascites, systemic manifestation, right side. Hemolytic anemia, systemic manifestation, right side. Hypertension, RAS, left side. Serum potassium low, RAS, left side. Clubbing of fingers, rewarding of hypoxia, left side. Hepatomegaly, sorry, hepatomegaly, systemic, right side. Anorexia, weight loss, weakness due to decreased metabolism. This is due to hypoxia, left side. Polycythemia, right side. No. When there is hypoxia, sorry, when left side, when there hemolytic anemia for right side, polycythemia for left side. Polycythemia or increased production of RBC is a response of the body to hypoxia, wherein there is increased secretion of erythropoietin that stimulates the bone marrow to produce RBC. So when a patient has elevated RBC, he has problems with chronic hypoxia. So it's left. Hemoptysis, left lungs. CVP, the keyword is right there, venous. So it's right side. Pulmonary artery pressure is high. Pulmonary, left lungs. And then it is systemic. Autosat, low, hypoxia. That is left side. Icteric sclerae, it pertains to the liver. So it is right side. Internal hemorrhoids, venous back up. It is right side. Syncope, cerebral hypoxia. So that's still hypoxia. And therefore, it is left side. Okay. See how easy it is if you know to apply Udan concept. So, yung mga concepts na yan, ilagay nyo sa index card. Para pag malapit na kayong mag-PNLE, basahin nyo yung index cards para ma-memorize nyo yung concepts. Let's go to the types of anemia. I will help you with this. Macrocytic normochromic anemia. Pernicious anemia. Pernicious folate deficiency anemia. So dalawa yung anemia na huge ang RBC. Pernicious and folate deficiency anemia. Pancytopenia. Aplastic anemia. Aplastic anemia. If you want to pronounce it as aplastic, go ahead. Okay, microcytic hypochromic iron deficiency anemia. IDA. Well, iron is the mineral is pronounced as iron kasi yung iron plancha. May pagkakaiba ng iron mineral, iron plancha. Okay? Chelosis or cracks at the side of the lips. IDA. Beefy red tongue. Pernicious anemia. Diyan sa inyo, i-check lang ninyo, di ba? Ititik lang ninyo. Okay? Beefy red tongue. Koilonychia, IDA. That is the spoon-shaped fingernail. Intrinsic factor deficiency. Pernicious anemia. Abnormal hemoglobin, short lifespan of RBC. Thalassemia. Thalassemia. Cyanocobalamin deficiency, that is vitamin B12 deficiency. Pernicious anemia. Vinson-Plummer syndrome, that is stomatitis, dysphagia, and wait, tatlo yun eh, SDP. Okay, anyway, Vinson-Plummer syndrome, that is IDA. Iron overload, that is thalassemia. Thalassemia. Okay? Now, we go to the third concept, arterial and venous insufficiency. Remember that in arterial insufficiency, low or no oxygen in the legs. Remember, arteries carry oxygenated blood away from the heart. Venous insufficiency, the concept is blood pooling in the legs. Remember that that the venous channels will carry unoxygenated blood back to the heart. Those will be your concepts. So, arterial insufficiency, no oxygen in the legs. Venous insufficiency, blood pooling or stasis in the legs. Sige. We do this together. Elevation of legs relieves edema. Back to the heart. Venous. Just write V. Venous. Absence of pulse. A. Arterial. Thin, shiny, hypopigmented. No oxygen. Arterial. Thick and hyperpigmented skin, the legs. Blood pooling. Venous. Venous. Edema, blood pooling, venous. Cold cyanotic skin, that is no oxygen, arterial. Ulcers at the ankle, sa mas mataas, venous. Warm reddish skin, blood pooling, venous. Leg pain on walking, arterial. Leg pain on walking, arterial. Lowering of legs improves blood flow, arterial. Pag elevation, venous. Pag lowering, arterial. Gangrene develops, no oxygen, arterial. Leg pain relieved by walking, venous. Pag leg pain worsened by walking, arterial. Okay? Pag leg pain relieved by walking, venous. Intermittent claudication, that is leg pain on walking or exercise, arterial. Calf pain or Homan's pain, venous. O, look at that ha. Pag intermittent claudication, arterial. Pag calf pain or Homan's pain, that is venous. Thrombophlebitis, venous. Raynaud's disease, arterial. Aneurysm, arterial. You have to mark it. Tomorrow, we will resume with breath sounds. Remember, in your curriculum, health assessment and physical examination is 3 units. So expect that, they will ask you about questions on assessment. Isa yung favorite na nila, yung 12 cranial nerves. Baka naman yung iba, breath sounds or whatever. Okay? So, did you learn something today, guys? May naitulak ba ng 4-hour session natin? I hope meron. Ha? Okay. So, I look forward to seeing you tomorrow. More concepts that will help you memorize long list of signs and symptoms just in 2 to 3 minutes. I promise you, matutuwa kayo. So, kung maaari, you should have index cards for the Udan concepts. Yung isang index card, right-sided, left-sided si Chef. Yung isang index card, yung susunod, hyperthyroidism, etc. So, it is always a pleasure, guys, to mentor you towards success in PNLE. You have to ace your PNLE for your bright future. Kaya nyo yan. Kaya nyo yan. Imposibleng hindi. You are with top rank. So, have a nice one and enjoy your lunch. Bye-bye.
Thank you po, ma'am.
Thank you, Sir
Thank you,
Al.
ma'am.
Thank you, Sir Al. Bye-bye. See you tomorrow, guys.
Bye
Same
po.
Same link? Is it recurrent?
Yes
Same
po,
link.
ma'am.
Okay. Thank you.
Thank you po, ma'am.
Have a nice one, guys. I had fun.